Naomba niwaambie au niwataarifu kwamba shughuli yetu mchana huu iko mubashara, inaendeshwa live kabisa. Kwa hiyo tuko sambamba namna hiyo, na hiyo ndio kidijitali. Nina heshima kubwa sana kukukaribisha Mheshimiwa Katibu Mkuu kutoka Wizara ya Tawala za Mikoa na Serikali za Mitaa, Profesa Shemdoe, kuungana nasi mchana huu katika wiki ya ubunifu Tanzania 2022. Tuko kwenye platform ambayo tunajadili nafasi ya ubunifu katika sekta ya afya, na tunafahamu na tunatambua umuhimu wa uwepo wako katika hii, na tutachukua vitu vingi sana kutoka kwako pamoja na wataalamu ambao Vodacom Tanzania wametuwekea leo kwa ajili ya kuwakilisha ni kwa namna gani wao kama kampuni ya mawasiliano lakini pia kampuni ya teknolojia wameweza kwenda sambamba na teknolojia. Naomba sasa ni mkaribishe Arjun kuja kukaribisha, just to give the welcoming remarks. Rosie. Okay. Naomba nimkaribishe dada Rosalind kuja kutoa ukaribisho na utambulisho mfupi, alafu nitamkaribisha moja kwa moja Jimmy Muchimba kwa ajili ya kutupitisha kwenye Digital Health Policy Paper, kabla ya kumkaribisha mgeni wetu rasmi Katibu Mkuu Wizara ya TAMISEMI kuweza kutuambia yale ambayo ametuandalia. Naomba tupige makofi mengi sana tukimkaribisha dada Rosalind kutoa ukaribisho na utambulisho. Karibu.
Asante sana Austin. Habari za mchana, mabibi na mabwana, na wale ambao wanatufuatilia mubashara. Nadhani hello. Habari za mchana. Asante sana Austin. Kazi alionipa Austin ni fupi sana, mgeni rasmi. Asante sana kwa kutujoin mchana wa leo. Naomba nitumie muda wangu kidijitali niweze kutoa utambulisho mfupi na wa haraka wa wageni wawili watatu ambao watakuwepo hapa upande wa Vodacom, na ningependa kuacha nafasi ya kipekee kwa wale panelists wetu wataenda kuwa introduced na Austin, kwa vile atasoma perhaps bio zao kwa kifupi ili tuweze kujua nani wako hapa kutoa mada fupi. Kwa ufupi kabisa, kama Vodacom, kampuni ya mawasiliano, tunafuraha sana kuwa hapa, na kama mmoja wa sponsors wa wiki hii ya ubunifu, ni mara yetu ya 4 ambapo tumekuwa tukichukua nafasi yetu kama kampuni ya teknolojia, kampuni ya mawasiliano, kutengeneza nafasi kama hizi ambazo tunaweza kushare na kuona mijadala ambayo inaturuhusu kutambua fursa ambazo zipo, kusikia maoni ya wadau na walaji tofauti ambao wapo kutumia services zetu. Kwa hivyo tuna furaha sana kubwa kuwepo hapa, na nadhani nikifika wakati wa kutambulisha wenzangu mtaona kwa namna gani jambo hili kwetu sio jepesi na tunalichukulia kwa uzito, kutokana na nani mtapata kuwajua wamekuja hapa kujumuika nanyi. Ningependa kwanza kabisa nimkaribishe na nimtambulishe Bwana Sitolize Mdlalose ambaye ni mkurugenzi mtendaji mkuu wa Vodacom. Sito, please say hello to the audience. Mheshimiwa mgeni rasmi, pamoja na sisi pia kutoka Vodacom kuna wakurugenzi wenzangu, naomba muweze kusimama kwa umoja wenu. Pia kutoka Vodacom kuna wafanyakazi ambao wapo katika idara hii ambayo inahusika na mambo ya uchumi na matumizi mazuri ya teknolojia na platforms. Naomba wote mlokuwepo pamoja na wengine ambao wako Dodoma wasimame kwa ujumla wao. Kwa utambulisho huo mfupi, Mheshimiwa mgeni rasmi, naomba nirudishe mic kwa Austin tuweze kuendelea na ratiba. Asanteni.
Naomba tumpigie makofi mengi sana dada Rose. Nashukuru sana. Mheshimiwa Katibu Mkuu, na heshima kubwa sasa kumkaribisha mbele yetu Bwana Jimmy Muchimba ambaye atatupa kwa kifupi au kwa mapana, lakini kwa kifupi sera inayohusiana na mifumo ya kidijitali katika kutoa kwenye huduma katika sekta ya afya. Na kwa kumfahamu tu Bwana Jimmy, nitasoma profile yake kwa kifupi. Jimmy Muchimba is a Health Business Development Manager at Mezzanine, a Vodacom subsidiary. Jimmy is passionate about the power of digital in enabling transformative policy interventions. Ni kitu ambacho anakipenda na anakifanya kwa moyo sana, kuangalia mifumo ya kidijitali na jinsi gani inaweza ikafanya kazi katika kuleta mabadiliko. Jimmy has worked across African continent, building strategic partnerships between public and private organizations. Amefanya kazi ndani ya bara la Afrika akijenga mahusiano, lakini sio tu mahusiano ambayo ni strategic, hususan katika sekta za umma na sekta binafsi kwenye yanayohusikana na masuala ya agriculture, microfinance, mining, health, telecommunication industries. Prior to joining Mezzanine, he was the National Sales Manager for BASF Zambia and had previously worked for Airtel Zambia in various senior sales and legal regulatory roles. He's a qualified engineer and holds MBA from the University of Wales in Cardiff. Mabibi na mabwana, naomba tumkaribishe Jimmy Muchimba, kwanza Tanzania, pili Dodoma, lakini tatu kwenye podium hii atupitishe kwenye sera za kidijitali katika sekta ya afya. Makofi mengi kwake. Jimmy, karibu sana. We are now ready to get the presentation from you. Yes, Permanent Secretary.
Thank you, Austin. Asante sana. Honorable PS, Permanent Secretary, I'd like to acknowledge your presence, Vodacom Exco, invited guests, and everybody else that has come to participate in Innovation Week Tanzania 2022. I appreciate the opportunity to be able to present a paper around how we can enhance our digital health system, strengthen our systems in Tanzania. This is based on my journey thus far. I have been in this space, the digital space, the past 6 years. I am very passionate about it because of its transformative nature, as well as its contribution to making societies productive. That's our mantra at Mezzanine. So when you hear me tiptoeing or crisscrossing between Mezzanine and Vodacom, it's because Mezzanine is like an IoT.next. It's a subsidiary of Vodacom as well. You will notice where you're seated that you'll have this flyer. Please take time to have a look at it. It will speak to some of what I'm going to talk about today. Okay. Okay, so digital innovation in healthcare, that's the title of our presentation today. It's going to take the form of a presentation. It's not going to be a typical paper. I want it to be more practical, so I want it to show where we're coming from, especially for the Tanzania market, where we're coming from, where we are, and where we envisage ourselves in the next few years going forward. Okay. So, meeting in the middle. Meeting in the middle, harnessing post-COVID rise of digital public health engagement in sub-Saharan. Recently, there's been a concept paper that was presented by Vodacom called Africa Connected. So what that paper sought to solve or realize was that in Africa today, we have had a pandemic. We are almost past it. What are the lessons that we've learned from the pandemic? What is it that we can do to harness the power of digital to take ourselves forward in the health space? You will hear me talk a lot about mobility. Mobility is, for us at Vodacom, just means the number of phones that are in the hands of people across Africa, close to 1 billion people. What are we doing to leverage that potential to bring about healthcare services that are strong and closer to the people? We talk a lot about cloud. Cloud is about data integrity, where we save our data. How safe is our data from a regulatory point of view? Governments, where I come from in Zambia, there's an insistence that data is hosted on Zambian soil for obvious reasons. Governments do not want their patient data, farmer data crossing borders. Okay, so meeting in the middle. So how are we going as governments and the public sector going to meet in the middle to mitigate the effects of COVID, mitigate not only the effects of COVID, and I would like to put this in context. I don't want us to sort of be in a silo or cocoon and think we can only deal around COVID, but what has COVID taught us and what solutions are available around the lessons that we've learned that can take us forward. Okay, this is some of the ways that healthcare is transforming with digital health. These are some of the statistics I've picked up. So 75% of African countries have a digital strategy in place. This is a good thing. It means there has been a start from somewhere. There is an all-time high of 180 digital health startups in sub-Saharan Africa. This is unprecedented. And as I like to say when I speak at fora like this, Africa did not participate in the previous industrial revolutions, electricity, auto, but the fourth industrial revolution, or 4IR as it is fondly known, is primed for Africa to participate and take their agenda forward, which is why when I hear that there are 180 digital health startups in Southern Africa, this is encouraging. This is the sort of data and information we should be leveraging on. 100% of African M-Health intervention reduce costs. There is no need to go into a solution or digital engagement that would not reduce costs, because ultimately, as a business, as governments, we all want to reduce costs for the benefit of our populations. The United Nations has its SDGs, and this is all tied into it. So this is a unique opportunity to reach the Sustainable Development Goals. Trust is a key at the intersection of formal and informal systems. So you will notice during the pandemic and sort of in the early days of the pandemic, a lot of informal sort of type digital health solutions came up. So this is where, I'll speak a bit about it a bit later, this is where the trust issue comes about. So how does the public or our populations trust information coming around these informal informal systems? Because you have your formal systems, you have your informal systems. 69% of South Africans and 55% of Kenyans report that they've seen health information that is absolutely false or untrue on social media. This is not good, this is fake news. So we need to get to a point where governments, together with public sector partners, bring to a place where people can begin to trust data, people can begin to trust the information coming out of health digital systems. Okay, so this is what I was beginning to talk about, the importance of public partnerships to build formal digital solutions. So I picked out a few from Africa Connected. I picked out a few quotes which sort of resonated and made sense to me. By continuing to partner and scale digital health services, governments and private sector actors can make significant steps towards reaching the SDG targets on health service reach. That's the SDG I spoke about in the previous slide. Africa's booming digital sector offers great opportunities for public-private partnerships to help build resilience in the aftermath of the COVID-19 crisis and respond to critical continental priorities. I touched a bit on that. That was by Dr. Ibrahim Mayaki, CEO of ODA NEPAD, Africa Union New Partnerships. The Lancet predicted that Africa is the best breeding ground for digital health systems to become a reality. Former digital health systems led by governments, key note the part that led by governments. So for me, these strategic partnerships between government and the private sector should be led by the government. So former digital health systems led by governments, enabled by the digital infrastructure delivered by the private sector, will bring this prediction to a reality. So if there is that relationship, that working connection between the government and the private sector, then this prediction can come to a reality. A few statistics there. 65% increase in smartphone reach by 2025. Mobility, what I talked about earlier, mobility, the number of mobile phones that we can leverage on that are in the hands of the African population. 100% of African health interventions shown to reduce costs. I spoke about that. Academic literature reviews have shown that 100% of African health programs reduce costs to serve beneficiaries, which is what we all aim to do as government as well as private sector. A unique opportunity to reach health sustainable SDGs. That's the same thing I spoke about earlier. So if I move to my next slide. Okay, so a few conclusions. Now is the moment for governments to capitalize on this and work in partnerships with the private sector to meet in the middle, my first slide, and use formal and informal platforms to digitalize services and improve health outcomes across Africa, especially on the critical COVID-19 vaccination rollout. Suffice to say, I said I would like this to be more of a health systems not centered around COVID-19 discussion. I'm sure that the view is the same held by other speakers to come. Digital health initiatives must be led by government with private sector participations. I am very passionate about that. Governments must lead in the front. I would like to see a future in which there is less dependence on donor funding, where in the budget there are budget lines that speak to financing these solutions, which are very critical for our people. Manage end user health adoption to ensure trusted, accurate information. Adoption is driven by trust. So the patients or our clients must trust us and must trust our information and not think it is fake for us to be able to have 100% user adoption. Understand how the informal and formal can combine in a way that is safe at scale. I've spoken about that. We need to be able to combine the two, informal, formal, and see how we can take them to scale. Next slide. Okay, so I'm going to just talk about one or two solutions. Then I'll come back in my 10-minute slot to talk about Health X. So what I just want to show is that there's been a journey for Tanzania around digital health within partnership with Mezzanine and Vodacom. So our journey delivering e-health solutions, Tanzania has been a key player, role player and enabler of our journey. So in about 2010, 2009, there was a solution called SMS for Life that was deployed in Tanzania. It was rolled out fully commercial in 5,009 public health facilities and completed in 2010. It was funded by Novartis as a start, so which is where you have these public sector government partnerships. The contract was taken over as a ministry governed since July 2023 with global fund support. So what happened is SMS for Life morphed into another product, which sometimes I say we took SMS for Life to private school to make what we call now SVS. SVS is what I'll probably talk about a bit more now. So the stock feasibility solution. The stock feasibility solution is a mobile cloud-based solution, which strives to reduce stockouts in facilities, in health facilities. So what it is you have your data points where you want to know how much is in stock level, the stock levels are in the clinic. Then you georeference it into a map which shows you likely areas of where there will be a stock out or areas where there's actual stock out, and then the data that you get from there is used by management for decision support. It's deployed in about 4,000 facilities. It's deployed in South Africa, it's deployed in Zambia. It's about to go live in Kenya. There are a total of 54 million total stock updates that we've done thus far since we deployed it. And we have 94%, which is quite impressive, sustained user adoption rate. It's also been deployed in Mozambique. So it's critical stock availability where and when it is needed to the last mile. Okay, so this is just a bit more around what SVS is about. So SVS is a last mile stock replenishment management tool. It can be used for essential medicines, it can be used for vaccines, it can be used for any other supplies that are kept at the facilities. So SVS can be used to monitor, order, and verify stock of essential medicines and avoid stockouts. By removing paper-based processes, SVS allows for last-mile visibility to assist in supply chain planning. SVS is a mobile technology to track stock levels. I've talked about that. So it's got a control tower supply chain planning sort of model where you don't silo things. So you have your control tower to be able to control the demand side and the supply side of things. So it has the following key features. You can record stock levels, receive stock, order module, ad hoc service, as well as it's got a BI, business information interface. Okay, this is just how it works. So you have your reminders and alerts. You have your stock level verification, end of day visibility, stock distribution and receiving. So we'll be able to know where your stock is at what given time. Okay, so this is just a snapshot of what has been happening around M vaccination in Tanzania from around about 2016 to 2018, at the beginning of the pandemic. The problem, despite global efforts, up to 1/5 of children ordered are not fully immunized. Supply and cold chain bottlenecks prevent facilities from consistently delivering immunization services, insufficient data. These are sort of the problems that a solution like SVS comes to sort of take care of. So our vision as Mezzanine and Vodacom is to support the Tanzanian Ministry of Health in increasing immunization coverage rates in children by integrating M vaccination into government information systems and scaling up to further districts. So a system like SVS is interoperable with existing systems in the Ministry of Health in Tanzania. It's also integratable into these systems, which means that you remove away the fear of having multiple solutions that are working in silos. So you want systems that are interoperable, that can integrate into existing systems, as well as complement the work of those systems. Okay, just a few statistics there. Bit out of time, so I won't dwell on that. Vaccination. So vaccination use cases. So you've got your South Africa, your Nigeria, your Tanzania, your Mozambique. There's Zambia now, as well as Kenya to come. I will talk about Health X, which is more how we tackle post-COVID problems in this e-health sort of environment. So I'll leave this for my next presentation. Thank you so much.
Naomba makofi ya zaidi kwa Jimmy. Asante sana Jimmy. Kazi nzuri sana Vodacom. Mheshimiwa Profesa Riziki Shemdoe, Innovation Week Tanzania 2022 imekuja kitofauti, na nimefurahi sana kwamba Vodacom wamewezesha huu tofauti na wanaendelea kuwezesha tofauti, sio tu kwenye Innovation Week lakini Tanzania kwa ujumla. Wakati serikali ikijidhatiti kujikita katika kujenga mazingira rafiki na wezeshi kwa uwezeshaji, na Vodacom kubadilika kutoka kwenye kampuni ya simu kuwa kampuni ya mawasiliano na teknolojia, leo kupitia dialogue hii ambayo tunaipata hapa kwenye Innovation Week, ambayo ina lengo hasa ya kuona nafasi ya public sector na private sector, tunashikaje kwa pamoja gurudumu la ubunifu. Tutapata nafasi baada ya kukusikia hivi punde kuona ni kwa jinsi gani sasa Vodacom are walking the talk. Wakati wengine tunasema tufanyeni hivi, leteni masuluhisho haya, tafuteni watu kufanya hivi, Vodacom is actually walking the talk, and we are truly privileged kwa wataalamu ambao wamewaleta siku ya leo kuchangia, lakini pia vile ambavyo wametuandalia kutuonyesha. Kabla sijawakaribisha, na nikiwa natambua kwamba tuna muda mchache kidogo na wewe, naomba nikuruhusu sasa, na wote tutafurahi kukusikia, alafu tutaomba ukae na sisi kidogo ili uweze kuona ni kwa jinsi gani Vodacom wanaleta ubunifu katika kuboresha huduma ya afya. Naomba tupige makofi mengi tukimkaribisha profesa aweze kuongea na sisi. Karibu profesa. Karibu sana.
Jamhuri ya Muungano wa Tanzania. MD wa Vodacom, wakurugenzi wote wa wizara mbalimbali mliopo, watumishi wa serikali mliopo pamoja nasi, wakurugenzi wa Vodacom wengine wote mliopo pamoja nasi mchana huu wa leo, wawakilishi kutoka USAID, PATH na Chuo Kikuu cha Muhimbili MUHASI, ndugu zangu waalikwa wote, mabibi na mabwana, habarini za mchana. Habarini za mchana. I hope everyone hears and speaks Swahili. So I will do that my speech in Swahili unless you object. I see no objection, so I'll go with my Swahili statement. Niko mbele yenu kumwakilisha Mheshimiwa Waziri wa Nchi Ofisi ya Rais TAMISEMI, ambaye angefurahi sana kuwa nanyi mchana huu wa leo, lakini kutokana na kazi mbalimbali zilizopo aliona anielekeze nami nifike angalau kuwa nanyi katika kipindi hiki kifupi. Ndugu zangu wote, mtakumbuka mwezi wa 4 Mheshimiwa Rais Samia Suluhu Hassan alizindua mfumo wa M-Mama. Mfumo huu ambao utatusaidia sana kupitia kwa wenzetu wa Vodacom kuweza kutoa huduma kwa mama na mtoto. Na Mheshimiwa Rais alisisitiza sana kwamba sisi kama serikali tushirikiane pamoja na ninyi kama wadau Vodacom, ambao mmeonyesha njia ya namna bora ya kutumikia ama ya kutumia mifumo ya kidigitali kwenye utoaji ama kumonita huduma za afya ndani ya nchi yetu. Kwa hiyo nipende sana kumshukuru sana Mheshimiwa Rais kwa maelekezo yake haya. Ndugu zangu, nashukuru pia kwa Mheshimiwa Waziri kuona ni muhimu nami niwepo hapa. Nisingekuwepo hapa na nisingewaona wadau wote ninyi, na nisinge pia watambua wengi wenu. Tulikuwa tunaonana kwenye social media, lakini leo hii tumeonana ana kwa ana ama mubashara. Kwa hiyo tunashukuru sana kwa kupewa nafasi hii. Niwapongeze pia waandaaji na wafadhili wote mkiwepo Vodacom kwenye juma hili ama wiki hii ya ubunifu Tanzania, mkiwepo ninyi Vodacom, Maksatu, kwa kuandaa hili kongamano, maana tunaona dhamira ya taifa na Watanzania kutumikia teknolojia kutatatua changamoto nyingi zilizopo kwenye jamii yetu. Ndugu zangu, tunaelewa kuwa ubunifu ni sehemu kubwa sana na ni muhimu kwa maendeleo ya nchi yoyote. Ndio maana serikali ya Jamhuri ya Muungano wa Tanzania inaunga mkono juhudi kubwa za wadau kutoka sekta mbalimbali, hasa sekta binafsi ambayo imebeba kipaumbele cha TEHAMA. Teknolojia ni kichocheo muhimu cha kuleta maendeleo ya kitaifa yanayoweza kujenga na kuendeleza ubunifu miongoni mwa wananchi na kuongeza tija na ufanisi wa shughuli zao. Kwa hiyo wote tuliokaa hapa tusijione tuko in a wrong place. Hatuko kwenye mahali ambapo sipo penyewe, tuko mahali sahihi ambapo tunapaswa kutumia sasa teknolojia kuhakikisha kwamba tunaleta ufanisi kwenye shughuli zetu za kila siku. Ndugu zangu, tumeona mifano kupitia kwa Bwana Jimmy alichokuwa anafanya presentation hapa. Amezungumza kwa mbali kidogo masuala ya mama. Amezungumza swala la stock visibility solutions. Lakini pia amezungumza masuala ya vaccination, ambayo haya yote ukisikia anaanza na maana yake anaanza na mobile, ama ninakosea? Hivyo vyote hivi vinaonyesha ni kwa namna gani communication ama mobile technology inavyoweza kutusaidia kukava vitu kwa urahisi na kupunguza pia mobility. Nilipokuwa naingia hapa nilikuwa namwambia mkurugenzi mkuu wa Vodacom kwamba hebu imagine sasa hivi ninatakiwa niende Kigoma kwenda tu kutafuta taarifa fulani ambayo kumbe taarifa ile ningeweza kuipata hata kwa kupitia WhatsApp. Siwezi kuipata kwa kupitia WhatsApp kama siko connected na Vodacom, kama siko connected na any mobile network. Ninazungumza siko connected na Vodacom ama any mobile network. Lakini unaweza kuchukua dakika 2 ukawa umeomba taarifa, umepata taarifa na umeweza kutoa solutions. Tunaweka vifaa vingi vya vifaa tiba maeneo mbalimbali. Lakini kuna vifaa vingine ni ngumu sana kuvinunua na kuvipachika kila mkoa na kuvipachika kila halmashauri, kuviweka kila kata. Lakini tunaweza kuwa na vifaa vichache ambavyo sampuli zinaweza kuchukuliwa mahali fulani, zikawa analyzed upande ule ule, majibu yakasambazwa nchi nzima kupitia mobile network. Kwa hiyo kilichopo hiki ambacho mnakifanya, ambacho mmekisapoti, ni swala kubwa sana kwa welfare ya Watanzania. Naomba mjipigie makofi wenyewe. Nimefurahi sana haya yote yaliyoelezwa na Bwana Jimmy kwamba ni njia mbadala ya kutatua changamoto mbalimbali tulizo nazo. Kwa hiyo mimi ninawatia shime muweze kuendelea na kuinnovate zaidi ili tuweze kupata huduma ama services ambazo zinaweza kuwafikia Watanzania wengi kwa wakati mmoja. Sisi kama serikali tutaendelea kushirikiana na sekta binafsi yakiwemo makampuni haya ya mawasiliano, Vodacom na wengine wote, ili kujenga Tanzania ya ubunifu na yenye manufaa kwa wote, kama kauli mbiu ya maendeleo endelevu kwa wote inavyosema. Sasa kwa kuwa workshop hii ni ya kazi, naomba mimi nisitoe hotuba ndefu. Nipende kuwapongeza wote mliojiandaa kutupa experience ya kazi ambazo mmezifanya. Kwa umoja wenu niwapongeze sana, lakini pia niwapongeze Vodacom kwa kuona ni muhimu kwenye wiki hii muwe hapa na kuweza kushirikiana na wadau wengine wote kuweza kutuonyesha nini kinachofanyika kwenu kwa ajili ya wananchi wa Tanzania. Lakini washukuru wote mliokaa hapa. Niwape mfano mmoja. Alikuwepo mtu mmoja anaenda kwenye mkutano na pepa yake akafanya presentation. Alivyoingia pale akakuta mtu mmoja. Sasa muda ulikuwa ni saa 8 na kikao kinaanza saa 8. Akamuuliza, where is the audience? Jamaa akasema, I even don't know because I'm also one of the presenters. Jamaa akamwambia, kaa pale, I have to do my presentation. And when he completed his presentation, he welcomed the other person, the next presenter. And the next presenter went, and he went there to sit so that he can be an audience. So you can come here and you don't find any person in the room. It would be very difficult for you to deliver what you have. So I'm not taking this for granted for you guys to be here all, because you have now decided to take your time to come here and listen to what all the presenters will be delivering to us. I'm not taking that for granted, and I thank you all for coming. I wish you all the best. I'll be with you for a while, but I will probably leave without telling anyone that I'll be leaving. But with all that, nawashukuru sana, niwatakie discussion njema. Thank you so much. Thank you very much. I wish you all the best. Asanteni sana.
Naomba makofi mengi zaidi kwa Mheshimiwa Katibu Mkuu kwa presentation yake nzuri sana, ambayo kwa kweli inaonyesha dira ya ubunifu sio tu katika sekta ya afya ambayo tunaijadili mchana huu, lakini dira ya ubunifu Tanzania. Nashukuru sana. Naomba makofi mengi tena kwake. Asante. Mheshimiwa Katibu Mkuu, sasa tuna heshima kubwa kuwaleta hao watatu uliowataja katika presentation yako, ambao Vodacom wataonyesha mifano kupitia kazi zao. Wa kwanza ni Julia. Julia, please come to the front. Yeye ni program manager wa M-Mama. Lakini pia, have a seat. Please have a seat. I'll bring all my three excellent people who will be coming to do this next session. She works for Touch Foundation. She has a background of management and consulting for a digital technology consulting company in Italy. She has been working in the healthcare sector in Tanzania kwa zaidi ya miaka mitatu. Naomba tumpigie Julia makofi mengi sana. As I mentioned, yeye ni manager wa programu ya M-Mama, ambayo pia Mheshimiwa Katibu Mkuu ameiongelea sasa hivi. Naomba Mheshimiwa Katibu Mkuu kwa heshima kabisa pia nimlete mbele yetu Dr. Isa A. Musa. Naomba tumpigie makofi, ambaye yeye ni mtaalamu mbobezi, na hapa leo kupitia Vodacom ataongelea stock visibility solution. Dr. Isa anatokea Zanzibar na atatupa experience ya huko Zanzibar. Yeye ni public health specialist, lakini pia ni mwalimu wa wataalamu wa masuala ya afya. Amefanya kazi katika Wizara ya Afya kwa miaka mingi, lakini kati ya mwaka 2017 na 2018 alikuwa manager wa mradi wa stock visibility solution, ambayo leo kupitia Vodacom Tanzania tutajifunza walikuwa wakifanya nini kupitia hiyo nafasi yake. Lakini kabla ya hapo alishafanya kazi kwenye program kama deputy program manager wa HIV na TB kwa upande wa Zanzibar. Naomba tumpigie makofi mengi sana Dr. Isa A. Musa. Na wa mwisho sio kwa umuhimu, lakini kwenye session hii naomba nimrudishe tena jukwani kaka yangu Jimmy. Jimmy, can I have you still back on the stage? Thank you so much. Jimmy atakuja tena kuongelea X-Health. Kwenye wasilisho lake alisema ataliongelea kwenye next presentation. Kwa hiyo sasa hivi tutapata nafasi ya kumsikiliza Julia, alafu tutamsikia Dr. Isa, alafu tutamalizia na Jimmy. Tutauliza maswali na majibu, alafu labda kwa nafasi yako tutaweza kukuruhusu. Kwa hayo machache basi sasa naomba tumkaribishe Julia, ambaye ni project manager wa M-Mama, aweze kutupitisha kwenye ubunifu katika sekta ya afya ambao Vodacom Tanzania leo wanatuonyesha wanautembea. Karibu Julia. Makofi kwake.
Asante. I hope that we can put the slides on perfect. Habari za mchana. Unfortunately, I will have to continue in English. My Swahili is not good to have a presentation, so bear with me, samahani. So thank you all for being here today. I really appreciate you taking the time and inviting me to talk about M-Mama. I think that a few people have mentioned the mama earlier, also the permanent secretary from TAMISEMI. So I think I will really take this opportunity, these 10 minutes, to provide an overview to the entire audience of what a mama is, why we decided to implement a solution like a mama, and where we're going. So please, if we can go to the next slide. Why a mama? So a mama is a program that was really created with the objective, with the ultimate objective to reduce maternal and newborn mortality and morbidity in Tanzania. How did we do so? By wanting to strengthen the emergency transportation system of the country. But I think that the key factor that it's really particular of a mama is the co-implementation and co-funding that we do with the government of Tanzania. And this is really important for us because we want to ensure ownership and sustainability of the program from the very early phases. And this is the reason why we started implementing hand in hand with the government from the beginning. We can go ahead, please. So, just to give you a little bit of a background before I start explaining you what a mama is and the solution, we started with the 3 delay model that hopefully most of you are familiar with. Basically, the framework that we used was to really understand what are the key obstacles for women to access the right level of care, pregnant women and newborns. And so we have 3 delays. The first delay is the recognition and decision to seek care. Basically here we're talking about a delay that happens at home, at the family level, in which there is a lack of understanding of the complications or actually inability to accept maternal health, and therefore there is a delay to understand that there is an issue in the pregnancy and seek care. The second delay is transport to care. And this one is really what happens when at the community level, at the community level, we may find poor road conditions or difficulties from lower level facilities to higher level facilities because they're very far away, or situations in which ambulances are not enough to support the patients and to be transported. And then the third delay is receiving a quality of care. And so this happens at the lower level facility and at the hospital, in which, because of lack of supplies, because maybe lack of personnel, because of lack of training, several reasons, there can be a challenge for women to receive the right level of care. And MAMA, especially now, is focusing really on delay number 2, and mostly because, one, we have provided a solution, a tech solution that really focuses its technology to address delay number 2, but also because we're collaborating with the government and with other partners to ensure that also delay number 1 and delay number 3 are addressed. We know that the government of Tanzania has been working a lot to improve infrastructure throughout the country, and I think that we're continuing to collaborate and to provide inputs based on our assessments on which are the areas that should be continued to be invested in. So this was just to give you a background of why did we think about a mama, and now I just want to tell you a little bit what a mama is, what are we talking about. So here you'll see that is a process that is basically describes the entire journey that a patient, a mama or a mtoto that has an emergency goes through when using the mama system. So the mom or the neonate will be experiencing an emergency. They can be at home or at a dispensary at a lower level facility. They have the possibility to call a free emergency number, a toll-free number that is active 24/7. And there will be someone on the line, a dispatch center, like a call center, that picks up the call. This person at the dispatch center will be able to collect all the information of the patient, understand the level of the emergency, the stage of the pregnancy, and through the application, through the MAM application, will be able to triage the patient so that they will be able to understand what's the exact condition that the patient is experiencing. And once that is identified, the app will tell the dispatcher which is the facility, the level facility that is required to treat the patient in the most appropriate way. Not only that, once the referral pathway and the triaging protocol is completed, the application will also tell the dispatcher which one is the closest facility, depending on where the patient is located, because we will have collected that information beforehand. And then the dispatcher will be able to arrange for a transport for the patient. The transport, of course, can be with ambulance, which is the first choice. It's always the first choice. The application will show to the dispatcher the closest ambulance, and the dispatcher will be able to arrange for the transport. But there are situations in which the ambulances are not available, and therefore that's when we also add and supplement with community taxi drivers. There will be community taxi drivers in all the villages around the patient where the emergency is coming from, and the dispatcher will be able to call the community taxi driver, pick up the patient, and bring it to the health facility. In the meantime, what is also very important, and the app allows you to do, is for the dispatcher, while the transport is happening, to contact the health facility so that they are ready and prepare to receive the patient and give the right level of care that they're supposed to. And this goes on until the patient arrives to the delivery facility, and the dispatcher is also, once the patient is discharged, collects the outcomes and follows up on what's the situation with the patient. They will be able to collect whether the mother is alive, whether she's had a C-section or a normal delivery, and similarly for the baby. All of this is done through the application. And I think the most important thing is also that we then collect the entire information that is collected through the app into the dashboard. We have a dashboard that tracks the live data of all the emergencies that go through the application, so that we are able to understand any issues, any challenges that there may be experiencing in certain facilities. If there is anything that has to be addressed, we have the numbers live that we can monitor, and that can help us to improve the system. And this is something that is extremely important for government officials, the RMOs, the RHMTs at the regions where a mama is happening, so that they can monitor the situation and understand what's going on. So hopefully I gave you a little bit of a background of what a mama is and what we do. And I just wanted to take some time to talk about what we have been able to achieve so far. Mama has been a pilot implemented in Shinyanga region over the past 4 years. And since then, we have been able to contribute to the reduction of maternal mortality in Shinyanga region by 38%. Shinyanga is quite a big region that covers 2 million of a population, and throughout the entire time between the pilot and the proof of concept, over 12,000 women and newborns were transported using the Mama system. And I think the thing that I was mentioning earlier that is really what makes the program a success is that now it's fully sustained by the government. It's fully transitioned to the region, and really there is a minor support from our side on Shinyanga. Everything in terms of budgeting, paying the community taxi drivers, monitoring the operations of the system is fully taken care of by Shinyanga, as a proof of the sustainability of the program. So where does this take us? I think I mentioned that we started in Shinyanga. We actually started in Shinyanga and Sengerema with a proof of concept back in 2013, and that's where we realized that the project could be successful. And so we replicated in an entire region, that was Shinyanga, where we were active from 2017 to 2021. And this was really the moment in which we wanted to test the sustainability of the program. And this is when we started co-funding the program between the program side and the government to test the sustainability. And those two phases were funded, were sponsored by, of course, the Vodafone Foundation, but also USAID, Elma Foundation, and other funders. And then, after the successes of those two first phases, we started discussions with the government, and that's when we landed for the national expansion. So since January 2022, we started the implementation of a MAMA in the entire country. And I think over the past few months and weeks, the program really has reached a lot of significance. And so now we have the objective of implementing a MAMA in the entire mainland and Zanzibar, and be live in all 26 regions by 2024, July 2024, with the constant co-funding and cooperation, co-management with the government of Tanzania, because the final objective is the one that I was mentioning earlier, full sustainability and ownership of the emergency transportation system by the government of Tanzania. So I think, nashukuru sana.
Asante sana Julia kwa presentation yake. Naomba tuweke maswali yetu, tutapata nafasi kama tutakuwa tuna maswali ya kumuuliza Julia wakati huo. Kwa hiyo sasa tuko na Dr. Isa ambaye yeye kama nilivyotangulia kusema mbobezi mtaalamu kutoka Zanzibar, anakuja kuongelea stock visibility solution na atatoa experience yake kwa upande wa Zanzibar. Na yeye ni mbobezi public health specialist, lakini pia ni mwalimu kwa ajili ya wataalamu wa masuala ya afya. Dr. Isa.
Asante sana. Ndugu kiongozi, katibu mkuu, other distinguished guests, ladies and gentlemen, huwa nimezoea ninaongea bila microphone. Asante sana. Niwasalimie kwa jina la Jamhuri ya Muungano wa Tanzania. Na hii ndio inatufanya kujidai zaidi kwa ajili ya muungano baina ya Zanzibar na Tanganyika. Na uwepo wangu jua kwamba ni peke yangu, lakini ndio ile ambayo alizungumza katibu mkuu, unaweza kuingia katika venue na ukakuta mtu mmoja, lakini umuhimu wake ukaonekana ni mkubwa sana. Kwa hiyo I will mix the languages. Kiswahili kwa sababu na mimi ni mbobezi zaidi wa Kiswahili kilikozaliwa kule Zanzibar, lakini nitachanganya kwa sababu presentation yangu nimeitayarisha kwa Kiingereza, lakini kuna baadhi ya wengine hawajaweza kujua Kiswahili zaidi, kidogo kidogo itabidi wawe wanaangalia slides zaidi. Nataka ni take through pale ambapo Jimmy ameishia. Kwa maana hiyo ile paper ambayo amedistribute pia itakuwa inawasaidia. Kwa sababu kwenda kuzungumzia stock visibility solutions ni aina ya utatuzi wa uwepo wa madawa katika vituo vyetu vya afya. Hiyo stock tunazungumzia ni dawa, ni vifaa na vitu vingine. Lakini visibility ni ule uwepo, ipo, zipo, hazipo. Manake kusipokuwa na dawa katika vituo vya afya, you won't see the patients. The patients won't come. Wagonjwa hawezi kuja kwa sababu tu hakuna dawa. Wanaweza waje consultation lakini hawatosheleze kama hakuna. Lakini tatizo jingine ambalo tumekuwa linazungumziwa ni kwamba with a new technology inabidi kurahisisha uwepo wa dawa. Uonekane, unaona zipo, hazipo. Unaripoti. Sasa hizi njia za kuripoti ndio teknolojia ambayo ndugu zetu wa Vodacom pamoja na Mezzanine waliokuwa wanazungumzia, wakisaidiana na Novartis Company kutoka Uswisi, ndio wamekuja kuwa tukifanya kazi nao. ili kuweza kuondoa hilo tatizo. Sasa pale Zanzibar, nitumie hii sijui, yeah.
Kwa hiyo next tunabonyeza hapa katikati.
Okay, fine. Yeah, natumia laptop zaidi. Kwa hiyo nitawachukua katika utangulizi kidogo ambao nimeuanza, lakini nitazungumzia hiyo stock visibility solution, value zake, how does the solution works na benefit zake, lakini pia timeline, process implementation ilikuwa inakwendaje. Lakini pia tutaona kwamba uwepo wa watu wa Vodacom imekuwa kama chachu au catalyst kwa ajili ya digital health strategy ambazo tumeanza nazo pale Zanzibar. Na tuona vitu gani tumejifunza kutoka kwao. Niseme tu nikionyesha hivyo, mnajua kwamba kuna visiwa viwili pale Zanzibar, yani Unguja and Pemba. We are not such much, ni 1.6 ile population sensa iliyopita. Tutahesabiwa tena, nafikiri this time tutakuwa 2 million plus. Tumeongezeka, tumezaliana sana kule. Na access ya vituo vya afya within 5 km radius unakuta kuna kituo cha afya. Nitazungumzia zaidi kwenye facilities zile ndogo ndogo, ingawaje huduma zimekuwa zikitolewa katika huduma zote, lakini nieleze tu kuna about 191 primary healthcare units zikisaidiwana na district hospitals ambazo sasa hizi nyingine zinazojengwa ziko 11 pamoja na hospitali kuu ya Mnazi Mmoja. Kuna specialized facilities, hizi zinajumuisha wodi za wazazi pamoja na mental hospital. Stock visibility solution hasa imekuja pale kwetu 2017 procedures zikaanza, lakini 2018 ndio tumefanya ile inaugurations. Na imeweza kusurvive kwa about 2 years kwa sababu tulikuwa tunakwenda na pilot. Ilikuta na misukosuko ya hapa na pale, issue za ugatuzi, issue za vituo vya afya kupelekwa tawala za mikoa, issue za vituo vya afya baadaye kurejeshwa tena katika sekta ya afya. Nataka niwaambie kwamba sekta ya afya ina work with autonomy kule Zanzibar. Our union, nilikuwa najaribu kuongea hapa na dada kwamba kuna baadhi ya sekta ziko within the union na sekta nyingine zimepata nafuu za kuwekwa nje ya union, lakini tunafanya with the good collaborations with other. Nichukulie sekta ya afya, sekta ya kilimo, sekta ya tawala za mikoa. Sasa kuna wakati tulitaka kuiga kidogo huku Tanzania bara, kudecentralize baadhi ya vituo vya afya, tukasema vipelekwe TAMISEMI. Ndio huo mwaka ambao wenzetu hawa walikuwa wanakuja. Elimu ikapelekwa TAMISEMI, kilimo TAMISEMI. Kwa hivyo watu wa tawala za mikoa wakawa na mzigo mkubwa sana, ikawa kuna confusion ya hapa na pale, lakini with the new government sasa hivi tumeambiwa kwamba tunaorejeshea tena. Kwa sasa hivi nafikiria baada ya presentation hizi tutarudi tena tuone tutakwenda kwa gia ile ile ya wakati ule au tutakwenda kwa gia hii mpya ambayo MC anaizungumzia sana ya IoT, ambapo tutakuwa tumeadvance zaidi. Na slide nyingi lakini sitozizungumza zote, nitazungumzia tu maeneo ambayo tumeweza kufanya vizuri. Significant changes zimetokea kwa Tanzania kwa ujumla, hasa kwa upande wa maradhi ya HIV, AIDS na nini kuhusiana na issue za malaria kwa misaada hii ya stock visibilities. Kwa sababu maradhi haya usipokuwa na dawa ni tatizo, lakini uwepo wa dawa unasaidia ku roll back haya maradhi mbalimbali pamoja na vifaa tiba vingine. Issue za kuripoti nini kipo nini hakipo zimekuwa zina ugumu wake. Tumekuwa tukizungumza hapa since morning leo kwamba watu wengine wanaripoti, wengine hawaripoti, lakini imekuwa ikieleweka kwamba ni challenges ambayo ina contribute issue za stock out, kuwa hakuna dawa, hakuna kifaa, hakuna nini, hakuna. Kwa hivyo watu wanasita kiasi ambacho kumbe hakuna kwenye vituo vya afya, lakini vipo katika main. Hiyo ndio tatizo ambayo na mgeni rasmi anaunga mkono. Mara nyingi katika vituo vya afya kunakuwa hakuna, lakini ukienda katika main stores hivyo vitu vipo, na wakubwa wetu hawa wamekuwa wakitushikia mkwaju kwa hili, kwamba kwa nini mnatuambia hakuna, tukienda hivi tunaviona. Kwa hivyo kumbe ni wanasema out of stock. Kumbe kama tukitumia hii stock visibility solutions tunaweza kutali, kwa sababu hii ni system ambayo inatumia simu. Ukiweka taarifa zako zinaonekana pote, mpaka kule Central Medical Store wanajua kwamba kituo X hakuna dawa aina fulani fulani. Na hiyo ndio ambayo tumekaribisha kwa wenzetu wa Novartis pamoja na Vodacom. Vodacom wana system nzuri sana, iko mpaka kule Pemba. Tulianza na district 2 Unguja pilot na district 1 kule Pemba, ambapo wao wana hizo machineries za kuweza kutupashia taarifa, na tukadistribute zile mobile phones ambazo tukatrain watu wetu vizuri sana, tukatrain MIT, wakaianza hiyo kazi mwaka 2018 ikawa inakwenda vizuri. Yale niliyosema ndio yanaelezwa hapo. Nataka nionyeshe kidogo jinsi gani hata Jimmy aliongelea hii. Unaweza ukaanza popote katika mzunguko huo, lakini katika simu ambayo umepewa, na hizi wamekuwa distributed mpaka wale managers katika district level, wana weekly data entries. Sometimes kuna baadhi ya information monthly data entries. Hata kama uko mahala hapana mtandao wa Vodacom, kwa sababu ile simu unaweza kutoka nayo baadaye ikawa ina access ya mtandao, basi ina upload hivyo vitu ambavyo ulivi-upload hata jana ambapo kulikuwa kuna mtandao. Kwenye peripheral vituo kule unakuta sometimes hakuna. The good thing nyingine, hizi simu unazichaji hata kwa kutumia solar systems. Kwa hivyo hata kule ambapo hakuna umeme, basi walikuwa wanapata access. La msingi ujaze taarifa, weekly data entries, sometimes monthly, na zina deal mambo ya malaria, mambo ya HIV, mambo ya vaccine, yayo ambayo tulikuwa tumeyapa vipaumbele, lakini unaweza ukaweka parameters nyingi ambazo unazihitaji wewe. Sasa unapojaza tu, uelewe kwamba kila baada ya wiki wakicheck, wakubwa kule juu wanaona, zinawapa taarifa zote. Wengine wanaona katika simu zao, wengine wanaunganisha katika mtandao wa netu, wengine hata katika desk zao. Na hili ndilo Mheshimiwa Waziri wakati ule Mahmoud Thabit Kombo, sasa hivi nafikiria ni balozi Italy, yeye ana mambo sana ya IT, alikuwa analipigia debe sana hili. Alikuwa anasema nataka nione taarifa hizi nikiwa ofisini pangu pale katika ofisi ya waziri. Na hii ilisaidia. Kelele zake zitusaidia sana, Vodacom watusaidia sana. Kwenye pilot tumefanikisha vizuri sana. Niseme contracting kwenye timeline and implementation process ilichukua about 3 months, where Vodacom commenced with design and configuration efforts. This was followed by national provision and district level training over 3 to 6 month period imechukua. In the beginning it was agreed that proposed periods will be 2 years, lakini tulifanya kwanza kwa 12 months, baadaye tukatakiwa kufanya evaluation ambayo niseme haijafanyika vizuri hadi leo hii. Kwa hivyo kuna haja ya kurudi na kwenda kufanya evaluation. All other initial procedures were successfully carried out. Tulifanya inauguration niliwaambia, na nitaonyesha baadhi ya picha kama itakubali. Yes. Hii ilikuwa wakati ule wa utiaji saini, agreement signing, na tulikuwa na representatives mpaka kutoka ubalozi wa Swiss, walikuja pale, tulikuwa nao. Asante sana. Nilisimama katika bendera siku ile nilipewa heshima kama aliyopewa huyu bwana, kwa sababu ilikuwa ni manager wa hiyo na nini, nikawa na address. Kwa masikitiko makubwa, mtu ambaye amekaa mama wa kike alikuwa katibu mkuu kwa wakati ule, amefariki dunia miezi michache iliyopita. Hapo ilikuwa katika shughuli pia za uwekaji sahihi. Kulikuwa na representatives kutoka katika different places, tawala za mikoa, Wizara ya Afya, our fellow from Vodacom, na hata unaona background yao inaonekana kama inavyoonekana leo hapa. It was early 2018. Yule ni naibu waziri wakati ule, alikuwa mama. Wanawake walikuwa na nafasi nzuri wakati ule kule Zanzibar. Nakaribia kumaliza, niseme pamoja na mambo mengine tulikuwa tunafanya, lakini uwepo wa Vodacom umeamsha sasa, kwa sababu viongozi wengine wanaulizana, mnafanya haya mambo msingi wake ni wapi? Do you have a background papers? Do you have strategy? Do you have policy? Zinasemaje policy zenu? Ikabidi lazima tukalazimishwa kutengeneza strategy guidelines ya hii, na ngoja nione kama itakubali. Tuna Zanzibar Digital Strategies following this as a catalyst. Wao wamekuja 2017-18, lakini 2020-21 ikatoka strategy ya 5 years, ambayo hiyo imetoa directives nyingi sasa, na inasimama na ile mihimili 6 inayosimamiwa na WHO. Kuna issue za human resource, kuna issue za health service deliveries, kuna issue za mambo mengine mengi tu. Kwa hivyo ni strategy ambayo imekamilika, inatoa kipaumbele pia kwa mama na mtoto, na maeneo mengine makuu yameelezwa humo. Lesson learned and success. Mwishoni niseme tu kwamba stock visibility solution, it has been proven to support elimination of medicine stockout. Hiyo tumeprove inaweza ku accommodate complete list of national essential medicine tunazozitaka kwa namba ambayo you can tell. Can link to other capabilities, reporting system, disease, other parameters pia unaweza ukazitumia kwa njia hizi za SVS. Easy to use, fast to implement, affordable and sustainable. Mobile solution run of solar charges somewhere, hata kama hakuna umeme, no need for electricity at primary healthcare facilities. Has made a remarkable contribution towards digital solution in Zanzibar. The contribution includes general assessment of various digital systems. Walifanya assessment pia wa kuona zile system nyingine ambazo zinatakiwa ziwe merged to under control of special department. Kumekuwa na huge number of health worker trained capable in managing and reporting their facility stock status. Training of district IT contributed a lot in continuing training and supervise other service providers in Zanzibar. Ime bring more partners, ile uwepo wao umesababisha, kwa sababu kwenye kusupport hii strategy sasa kuna a lot of partners wana join in. Alafu their contribution resulted in formulation of 5 years Zanzibar Digital, hiyo nimezungumza na tunashukuru sana, na tunasema kwa hili basi with this IoT now they have to come back again in Zanzibar, tuone tutakwenda more faster zaidi. Asanteni sana kwa kunisikiliza.
Asante sana Dr. Isa kwa wasilisho lako hilo zuri sana kutoka Zanzibar Stock Visibility Solution. Kama tuna maswali tuyaandike chini, alafu tutapata nafasi kuyauliza baada ya vitu viwili vifuatavyo. Kwanza ata present Jimmy. Jimmy, please get set. Yes. Slides za X-Health. Alafu tutapiga picha za pamoja na mgeni wetu rasmi. Tutamruhusu kwa sababu unajua na safari. Alafu tutaendelea na maswali na majibu. Ndio ratiba fupi ya sasa hivi. Kwa hiyo naomba watu wa technical mtuwekee hizo slides za X-Health ili tuweze kwenda sambamba.
Good afternoon once again.
Nenda mbele mpaka ukutane na X-Health. Hapo hapo, rudi nyuma slide moja.
Okay, I'm not going to take too much of your time. I did spend quite a bit of time explaining some of these processes. I know most of you who've sort of interacted in the health space have heard of what is known as the Continuum of Care. The Continuum of Care is simply taking care of the patient from the beginning to the end. If you are in technical spaces, you probably say you want an end-to-end solution. So for me, HealthX is a digital continuum of care which strives to sort of take care of all the processes around the patient as they're being taken care of and being provided for in a healthcare facility. So at Mezzanine and Vodacom, we pride ourselves in having a very highly configurable platform where SVS, M-vaccination, and all other health-related products sit. That's where the interoperability I spoke about stems from. So here I said HealthX is a multi-tenant, patient-centered healthcare platform. So you want to put your patient in the center, bring all your digital capability and take care of them from the center. So you have your demand side, you have a supply side. Your demand side is beneficiary management. So you want to manage the patient in terms of who they are, what the problem is, how old they are, where they come from. So that is more a beneficiary management program, which is more on the demand side, which is the pull to the system. Then you have your supply side, still putting the patient in the middle. You have your supply side where you want to take care of where are the medicines, how soon are they running out, do we have them, are they in a central depot somewhere? So that's more the work of SVS, more the logistics side, knowing the levels of stock levels of medicine in the facility. Essential medicines, it could be at an M-vaccination level, it could be the vaccines, where are they, where's the PPE, and being able to track the process. So I said a platform service with aggregation. So we want to aggregate all this information, orchestrate it, data manage it, which is very important, and the quality of the data must be good, and workflow services to support universal health care, free for service, value-added service, and low-cost insurance products. So at the end of the day, you want to use all your capabilities, all your digital solutions, bring them together, bring the patient in the center so that you are able to provide an end-to-end solution. So it's an SVS in there, it's an M-vaccination in there, it's all other health solutions, it's an M-Mama, bringing them all together into one ecosystem. Okay, and that's where I see the future of digital services, and hence the term HealthX. Thank you.
Asante sana. Naomba tuwapigie kwa ujumla wao panelists wangu au presenters wetu mchana huu kwa wasilisho lao. Mheshimiwa Katibu Mkuu, natambua muda wako. Kwa naomba sasa tupige picha za pamoja makundi yako matano. Baada ya hapo tutakuruhusu ili tuendelee kwenye session ya maswali na majibu. Lakini nikupe wewe nafasi kabla hujaje tupige picha hapa mbele, kama una swali la kuuliza wataalamu wetu lolote. Au una swali moja tu, karibu.
How do we get out from one region to 26 regions? We have 25 more regions that we still need the service. The same to the Zanzibar project. How do we scale that out from Zanzibar? I understand that we may have some areas in the mainland that we are applying there. But how do we roll this out all over the country? I don't need the answer for now, but take that as food for thought. And maybe when you conclude, I'm sure we will leave the communique at the end of the day. So maybe that one will be deliberated by this meeting. Thank you.
Asante sana Mheshimiwa. May I first and foremost, since my speakers are here, can I call all other speakers to the front? All other speakers for this evening, panelist speakers, please come to the front. The next picture will be by Vodacom management and staff, and then all of us. Naomba wale wote ambao watakuja kuongea kuwakilisha mada mbalimbali, please come to the front. Nikuombe Mheshimiwa Katibu Mkuu, mkurugenzi wa Vodacom na dada Rosalind pia tujiunge. Yes, tuwe picha pamoja. Nikisema innovation tunasema Tanzania. Innovation? Innovation? Innovation, Julia. Innovation? Excellent. Innovation? Yes, let's take innovation. Katibu Mkuu amesema tu scale up, tuhakikishe imeenda maeneo yote. Sawa. Naomba sasa speakers tuchukue viti vyetu, alafu nikaribishe Vodacom management. Naomba Vodacom management ambao tuko hapa, naomba tuchangamke kidogo. Exco na staff wote wa Vodacom ambao mko hapa, na waomba naomba tuchangamke kidogo. Katibu Mkuu inabidi akimbie, anasafiri sasa, tusiwe chanzo cha kuchelewesha. Vodacom staff, tunaweza pia kusimama hapa mbele. Excellent, hii ni picha nzuri sana. Ukumbusho mzuri, bado mmoja anakuja, wana Simon. Safi kabisa. Innovation. Innovation. Ubunifu. Asante sana. Naomba niombe watu wa upande wa huku kwa pamoja, kwa umoja wetu tuinuke wote chap. Naomba tuchangamke kidogo. Naomba Mheshimiwa Katibu Mkuu nikushushe hapa chini, kwa chini hapo. Yes. Asante Rosa, pande huu. Asante. Naomba tuchangamke kidogo, muda sio rafiki. Joe, UNDP, Costec, naomba tujiandae, baada ya tutapiga hiyo picha pamoja. Sijaona. Nikiwaita tunachangamka sawa kuliko hawa. Ubunifu, mjachangamka kabisa. Yaani Katibu Mkuu amechangamka kuliko nyinyi. Innovation? Innovation. Innovation. Excellent. Naomba watu tuliokaa upande wa huku tupige picha ya pamoja na mgeni rasmi, alafu itakuwa picha ya mwisho. Nilimwona Joma ni Rakiza hapa. Sio ameenda hapa. Kakimbia. Okay, sawa. Naomba tuchangamke kidogo tuliokaa upande wa pili. Tuchangamke, tuchangamke, tuchangamke. Naamini tumeandaa maswali yetu ya kuwauliza wataalamu wetu. Tujiandae sasa tutakapomruhusu katibu mkuu tuweze kuuliza maswali yetu, tuweze kupata majibu, tuweze kufahamu pale ambapo panahitaji kufahamu zaidi. Innovation, innovation, ubunifu. Vodacom oye, oye, oye. Excellent, nashukuru sana. Naomba tukaketi, lakini sasa nimruhusu mkurugenzi pamoja na Rosalind waweze kumtoa katibu mkuu kwa heshima yake, kutenga muda wake. Naomba tusimame tuweze kumpigia makofi mengi kwa shukrani. Asante sana, tunakutakia safari njema na kazi njema. Asante sana. Asante, naomba tuketi sasa. Can I now bring Julia, Dr. Issa and Jimmy back on the stage to take the questions from the audience. We shall be doing this for the next 10 minutes, and then I invite my second plenary for the evening. Where's Jimmy? Jimmy stepped out. Naomba niangalizie Jimmy. Sasa ni nafasi yetu ya kuuliza maswali. Maswali ya awali yameshauliza katibu mkuu. Naomba nitoe nafasi kama kuna mtu ana swali lolote kwake Dr. Issa au kwa Julia. Nafasi yetu ndio hii hapa. Utajitambulisha tu kwa kifupi chap chap na swali lako. Tutachukua kama maswali matano hivi.
Mine is not question. Mine is not a question. My name is Ntuli. I work at the President's office. Just to compliment on Julia's presentation that for the innovation to flourish, you need stakeholders' engagement. So part of the things, or some of the things which we did while we were in Shinyanga, we did our stakeholders analysis. We identified who are the key players, and then we used several sessions to actually introduce the agenda to these stakeholders. And from there, then taking off, it was very smooth. So for the innovators in the house, one of the very important thing, or the take-home message, you have to really make sure that you do stakeholders analysis before trying to roll out to the entire country or to the entire region. Hiyo ndio ilikuwa mchango wangu.
Asante sana Dr. Ntuli, tutamsikia na yeye ana presentation, lakini ameongea jambo la msingi sana. Kabla hujabuni, ni vema sana kufanya stakeholders analysis, kujua wao unaowabunia ni watu namna gani na watanufaika vipi na ubunifu wako. Chap chap. Jina lako, swali.
Asante. I am Pascal Kija, a student from MUHAS, Muhimbili University of Health and Health Sciences. So I have a question to Julia, but before I give my question, I would like to congratulate her for the good job that the Mama emergency transport is doing. But I have also a few added value that can help to increase the service in the Mama. If I can share a bit later on, I'll be glad. So my question is, for the concern of Mama, it's going to work in rural areas especially, but I've been a resident in the Shinyanga region for much of my life, and there are very few ambulances as well as community drivers. Now my question, are there going to be employed community drivers for this emergency transport, or we are going to use which kind of means to make sure that they are available immediately, right, when a mother needs care? Thank you.
Okay, my name is James Kalema from MUAS. So I have also the question to Mr. James in digital health solution. So I'll just ask, most of the digital health solutions are it's not easy to commercialize them, and most of the investors need to see the output, need to see the benefit after investing on your digital solution. So how can we commercialize the available digital solution? How can we come up with the digital innovations which can have benefit to the investor? You can come up with a good solution which can have good impact, but it has no business component within it. So I was trying to give us an advice on which solutions can we come up which can have potential for investor and for the innovator.
Good afternoon. My name is Dr. Faraja from Benjamin Mkapa Hospital. My question is to to Julia concerning M-Mama. We have seen that it has helped in reduction of maternal mortality rate and neonatal death to like 60%. But have you considered the education part of M-Mama, educating the women from pregnancy to post-delivery, improving the health of the mama and the baby? And on transporting, you have said about the increase on the vehicles and the employed drivers, the community workers, but could you please think of incorporating with the health workers? Because in Zanzibar, the ISA has said the primary health facilities are in like 5 kilometers from the communities, but I think it's a bit different in Tanzania, yes. So you could be incorporating with the health workers so that when the mama is being transported to the health care, there is health personnel in the transit. Thank you.
I'm Anodi Kayola from the University of Dodoma. My question goes to Madam Julia. How a mama is working to improve the early seeking of health care to pregnant mothers, because that has been also the common problem in healthcare facilities. Thank you so much.
This side, tulikuwa tumewacha nje na wasiwasi upande huu. Sijapata swali, at least kuna mkono moja, and then you'll be the last one to ask.
Thank you. My name is Kalebi Moshi from CBE. My question will be directed to Madam Janet. My question will be to pregnant women. How do you take care of them when they get or they have a problem in their bones? Because you will use radiation. How do you take care of them so as you can protect a child and the mother, so as both of them they can take a service and save their life?
Sante, last but one question from you, or the lady? Yes, thank you. Two last questions.
Thank you. I'm Judith. I have a question to all the panelists. I'm asking, I think your solutions have the potential to collect a lot of data that can be used for research for new cures for diseases. Do you plan on doing that?
Thank you so much. We also have followers online and they have questions. Can I have those? Are you going to read those questions or are you going to write them down for me?
Yeah, so just something to build up on the commercialization side. Based on the current digital health strategy, along with interests of development partners for public health solutions, typically there's a big push for global goods and open source technologies, and especially technologies being built by private companies. We'd love to know plans for open sourcing the solution or integration with other technologies that the innovators might be building. Thank you.
Thank you.
Okay, my name is Baraka Range from University of Dodoma. My question goes to Madam Julia, that you say that the M-Mama based on the rural areas. If it's basing on the rural areas now, the question is, how is the cost of those taxi drivers from the home to the hospitals? And the second question is, now if you consider taking the local drivers to being an taxi ambulance within a local taxi driver, would be there any assistance or anyone who is kwamba anauelewa kuhusu afya ikoje?
Yeah, I'm Baraka Meremo from University of Dodoma. I have a question and a compliment. We know in Africa, as far as Africa is concerned, transport sector is still an issue. How? For example, we have a scenario, for example, in the urban, where a fire break outcomes and a person calls 911. But what it happens is the fire vehicle, it delays to reach the place, regardless that it is in town and there is a lot of petrol stations and the road is concrete and it's okay. So what about in the rural areas where you find that a pregnant woman phones the call and a delay occurs? Since in the rural areas there are no adequate petrol stations and the road is not that concrete. So what I'm afraid is a delay might occur as the ambulance or the taxi arrives, then leads to the death of the infant or of the mother. So my solution was, instead of the ambulance coming alone, which it might experience a delay, at least it might carry a health official, for example, a nurse or a doctor, so as in case a delay happens, they may be able to help the infant or the mother. Thank you.
2 comments and 1 question from participants online. This is a nice presentation and all, but introducing it as a digital health policy paper was a bit of a reach. Hi all, I'm Deogratias Rutatwa, CEO of Nakopa. Congratulations to Vodacom for this key milestone, and to you, Julia, is mama considering messaging related to healthy pregnancy? Question is mama considering messaging related, I believe this is messaging related services to healthy pregnancies? Okay, now I kind of think from your presentation it's more of a call, but then can people actually be able to send SMSs as well so that they can access the services? And from me to you, Dr. Issa, apart from the question that has been asked by the PS, but how are we able to not only learn but control? You know, this is stock visibility. You've mentioned the issues of stock being available at the stores but not at the facilities. Then how are we able to ensure that they, one, reach in time, as we learned from IoT this morning? So the issues of making sure that they reach in time at the facilities, but also be able to control that what is at the facilities is actually what is offered to the patients, because we've had cases whereby the nurses, the doctors, or the nurses to be precise, have their own medicine and they supply them, they sell them to the patients. So how does this platform actually provide a room for control of the medicines? Thank you so much. Julia, maybe you want to start to respond to the questions, because I think many questions have been directed to you. Karibu.
Hello? Yes. Thanks so much. I hope it works well. Yeah, you can hear me. Yeah. Thanks so much for all those questions. I'm very happy just because it means that I passed some messages, so thanks a lot. I think I'm grouping the questions in a few topics. There were a couple of questions around the community taxi drivers. I think the first one was around someone from Muhas that is in Shinyanga, and so I think your point was around there aren't actually so many ambulances and there aren't so many community taxi drivers, as you know, in the region. I think at the moment we have 76 drivers that have signed MOUs with the government that cover the entire region, and it's a work in progress usually. It's part of the government role, the region, to recruit new drivers in case there are some that drop off, but at the moment I think that what we're seeing from the data that we have collected so far over the past 4 years is that there is a quite equal coverage of the region with this amount of ambulance drivers and community taxi drivers. But I think that the power of the data by monitoring through the dashboard is this: if in case we realize that there is a gap, you can always go back and try and recruit more drivers. And I think connected to the driver's point that someone else made, how does the costing work? I think that, so in each region, we are negotiating with the drivers and with the regions on the price per kilometer that will determine how much a driver will be paid. And at the moment is really something that we are discussing with the government, and then it's being negotiated by the regions and the legal officers of the regions with the community taxi drivers to finalize and sign an MOU that will stipulate the amount that each taxi driver will be paid per kilometer. So this is how it works as of now. And I think I also wanted to mention that, of course, the community taxi drivers, they have their own private cars, so they're not driving an ambulance. They're driving their own private cars that have been checked, quality checked, and secured to be used for a pregnant woman to be transported. So the program on our side, before recruiting the drivers, ensures that the cars have all the requirements that are needed. Also something connected to the community taxi drivers and the ambulances. I don't remember anymore who asked this question, but I think there was a really good point around having an escorting nurse that comes along. And this is what usually happens when an emergency comes from a dispensary, a lower level facility, and has to go to a CMONG center. Together with the community taxi drivers that will go to pick up the woman, there will be also an escorting nurse that will go throughout the entire period to the facility that is the destination facility with the woman. A couple of other questions. I think there were a few things around the community awareness of the system, and I think also, you know, training at the community level, or not training, but really awareness of the importance of maternal health, the importance of healthy pregnancies, and all of that. So, as I said during the presentation, the focus of Mama, as of now, is you know, strongly on delay number 2 in implementing a transportation system, but there are also a number of activities that are done by the program in collaboration with the government and other implementing partners that are already on the ground to sensitize as much as possible the population on the ground through community healthcare groups, through the ANC visits where women go and attend so that they can be aware of the system, community engagement strategies such as promotion of the program through radio channels or billboards, so that the community can really be aware of this service that is being implemented in the region. And then I think a question around the system itself, that was if it's open source or not. This is something that we had to deal with a year ago, probably. We basically selected a new solution that was built on an open source system because of what you said, because it's necessary to ensure that any solution is built on an open source. So at the moment our EMAM application is open source, and we're having discussions constantly with the ICT government side, PRALG, MOH, and so on, to ensure that everything is done according to the policies of the country, of Tanzania. I really hope I answered most of the questions. Thank you. Thank you.
Thank you so much. Dr. Issa, as you're responding to that, there's an additional question online. If it relates to you, Julia, then you will respond to it on the last minute of fame that I will give all of you. Through these solutions, how do we take care of fraud, and are there consideration on enhancing operational efficiency? I think this is a cross-cutting question to all of us. We should actually all be able to respond to it. So how do we take care of fraud, and are there considerations on enhancing operational efficiency? This is another question from our followers online. Dr. Issa.
Yeah, thank you very much. Though a number of questions went to my friends here. Maybe because I tried my level best to describe it clearly and explain in Swahili. I've been combining, that's why people they understand more than what I've been thinking. Well, issue of the guest of honor pertaining to how we can roll out. Yes, this is very important, because now you might find in some other places they are still using paperwork. They are putting things on paper and forward it through district health managements. When they come in, they take papers and send it to central medical stores, and then they counter check, while the other people, they are using this mobile. So there are also a kind of confusion between these two. Now it's the right time, and in fact, we are a bit late to roll out with the other districts. In fact, some of the things which I told you, that there are certain kind of interference with this including issue of decentralizations, but unfortunately in Pemba there was no big store to store these drugs. Fortunately, we have built a new store in Pemba. Now we are having no problems with storage and distributions. So I think it's the right time to do evaluations, and evaluation also is part of research. As Judith asked, we need to think about research also. You need to evaluate. When you evaluate, you do a kind of research. But then you need to have time for implementations. Of course, I agree with you, even in the ministry, there are departments which deal with research. They're supposed to conduct regular research so that we can evaluate ourselves on the process, whether we want to proceed with it or we want to terminate and think about other innovations. The issue of fraud and how we can manage to control, yes, as you have said, and other people from the net, that drugs is a kind of commodity which everybody wants to have. Even if you are not sick, you can say, let me take it. To the time when I get sick, I will use it. Let me take it when sometime government gets sick, I will sell for him or her. But there are always control. The presence of stock visibility solution is part of controlling, because you keep on monitoring. The mobiles can tell you what kinds of drugs is not available, what kind of drug or commodity is running faster at what particular facility and why. Is there a kind of disease? So you need to make follow-up to the area whereby you find there might be some of fraud, there might be something happening. Why in this particular area, why in this particular X facilities, this kind of tetracycline is moving out just like that? They are registrar, they put a register. Whenever they consult patients, they're always writing. Though we say in some area, but we keep records for all those kind of. They do regular monitoring. The district health management team, they do quarterly or sometimes ad hoc kind of supervision to their areas. And my friend in Tanzania, we are very good in security. There are always people, we name it police in bracket, they can tell that in such kind of facility or such kind of persons is stealing drugs, and we will catch you. Thank you very much.
Asante sana. Jimmy, over to you.
Thank you very much. I think a question that was directed to me was by that young man over there. He wanted to know, or is grappling with, how do you monetize or commercialize innovations? Yeah, if you look back to my presentation, there are so many innovators in Africa and let alone Tanzania at the moment. So my advice to you would be, first of all, what are you trying to solve with your innovation? That will help quite a bit. Also, you need to step back and look at ideas, or in your ideation process, look at something that is more disruptive. Google, Uber, something more disruptive. Don't reinvent the wheel. So create or innovate solutions around health that sort problems. SVS was built to come and solve a particular problem, stockouts. How can we also be able to know how many medicines or how much medicine is at a facility? And they solve that problem. Anybody else coming to do it is reinventing the wheel, meaning it's going to be a lot more difficult for you to monetize or commercialize your idea. So stand out, be disruptive, don't be part of the crowd, and innovate ideas that bring change, ideas that are different from the rest. So that's what I would say. So you wanted to know about, I didn't get your name, you wanted to know about IP. So for us, as Vodacom, the IP is proprietary. But what we've done over time is to allow developers to be able to play on our platform and be able to develop ideas on our platform that are not yet open source, but as time goes in the future, I'm sure that is where we'll be headed, to sort of harmonize those two things. But as you know, it's quite a big topic. Thank you.
Thank you, Jimmy. We have a question from Pio Ralj. This is President's Office, Regional Administration and Local Governments. He's a developer, or she's Jafari, so he's a developer. For sustainability of this innovation solution, what is the involvement of the technical experts on the government, the size of e-government, Ministry of Health, Pio Ralj, etc. So how are they involved in the process of developing these innovative solutions? Would someone from Vodacom want to respond to that?
Oh, I can start and they can continue, because we have been always involving those people. As far this one is not working. Yeah, it was very far from my mouth. Yeah, with new kind of technology, there are people who know more than what others know. So you need to invite them, you need to work in collaboration with issue of e-government. And as far as IT, digital kind of things are concerned, you must involve them. They need to know what is going on in their country. We do hand in hand with them, like what we are doing now in Zanzibar. I have just told you that we have come out with the digital kind of health strategy. And in preparation of that strategy, we have involved all those kind of stakeholders. Issue of involving stakeholders as my yeah, you need to involve them, and at all level, at district level, at regional level, at national level, at technical level, to the area on which you can find them, even partners. There are other partners. When we say we are involving Vodacom, they are technical people also, and we are involving them from different countries, including from South Africa. We have noticed today we are having our good friend Vusi. Where is he? He's still here? Yes. He's a technical people with the new technologies. He will go back and come again. Even he will cross the sea to Zanzibar. You are welcome, so that we can use your innovations. Now is your turn for Vodacom. Thank you.
Asante. Let's give my panelists 1 minute of fame each to just give us one statement to wrap up the sessions. And then I will invite Rosalind to also add up to M-Mama. So as soon as you speak, then Rosalind will add up to your remarks. And then that will mark the end of the first session. We'll do a 2 minutes break and then invite my panelists for the second plenary. Karibu.
Asante. I think I will just conclude answering the question that we received by the PS about rolling out in the entire country. The way we're thinking about it for M-Mama is proceeding by clusters. So we're grouping a few regions into one cluster and then keep going on and on every month so that we have time to engage with the regional stakeholders beforehand, build those relationships, create the awareness that is needed, collect all the data that is necessary, and then roll out in a country. We're going live in Lindi and Morogoro in July, and then I think from December, January onward, we will roll out in 2 regions every month to ensure this phased out approach. So I will leave it like that. Yeah, thank you.
Thank you, Julia and Austin. I just wanted to add a very quick remark on the M-Mama front. In addition to what we may have seen at the very top of this presentation on Mama, that the intervention went to reduce maternal deaths by 38%. And I think there was a very good question that came from this corner that may not have been responded to adequately. If I may take this opportunity to just add a bit there, and I think this is really the essence of why we have these discussions, because we get to hear and to spark discussions from everyone. And I'm very intrigued and inspired by the questions that are coming from our young people, because it means we are thinking forward, we're looking at problems, and happy to tell you that one of the questions that was not answered is one that has been embedded in how the program runs, the Mama program runs. And at some point, I'll welcome Dr. Ntuli to respond a bit to one of the last questions that came up. I think it was from the internet, about how the participants online, about how local government ministries are involved. And I'd like Dr. Ntuli to reflect on that quickly. But the question specifically was around, okay, so what happens when those taxes maybe break down and it's an emergency case? Who asked that question here? It was you. It was a very good question. And how the program responds to that, to your question, is already part of the program, right? So today, if a mother is being transported, because we're using technology, we're able to see when she calls or when a family member calls in an emergency, from the platform, we see exactly, based on GPS, where that mother is, right? And we're able to locate a taxi, an ambulance that is closely located to where the mother is, right? So that call is logged. That emergency, as it starts to be transported, is seen on a dashboard. If something happens to that taxi, and of course, the driver is trained, and that's how Ministry of Health comes in with the technical expertise. A healthcare worker also accompanies that driver. So the mother has help even in the car, okay? So if that car in transit gets, either it runs out of fuel, which was your question, or has a breakdown, from the dashboard, you're able to see at a certain location, at this junction, this has happened, or you don't know perhaps what has happened, you just see that they're not moving. The dispatcher calls and asks, what's happening? We're waiting for you. It's an emergency, remember, so everyone is alert. And the system is live. So if the Minister for Health wants to see what's happening, or Minister for Local Government in that matter, they're able to log in and see how many emergencies have been reported nationwide at any given time, no matter what time of day. That's technology, good use of technology. So if they see and they call it in and they find out there's a breakdown, they again use GPS location to see which other driver, which now speaks to the 76, for example, that
decision-making space, kwenye decentralization by devolution, all the decision has to be made at the primary health care level. So you have to make sure that you create an enabling environment for them to be able to actually make decision on their own. And from there, then you who are working at the national or sub-national level, you should just be there to guide them whatever challenge which they are experiencing. So in a nutshell, this is what we have been able to enjoy for the past 5 years. And for we, as the President's Office, we embrace innovations. We invite different scientists, youngsters, to come up with innovative ideas and work with us to simplify or to address the challenges which we are experiencing right now. Asante.
Asante sana, Dr. Ntuli. We are going to eagerly wait to learn some of these systems and products that you've, so far collected. Over to you, Gemma. Innovation in the health system, your contribution, your engagement, your involvement, having been at the US aid and in the sector, of course, for over 12 years. Tuko wapi? Tunaenda wapi?
Asante sana. Yeah, so for me, I'll be speaking on behalf of USAID, but also on behalf of the development partners. As you all know, that development partners in health, we are here to support the government to reach their goal to provide quality healthcare services to the people of Tanzania. So whatever we are doing, we are here to support the government. So everything that Dr. Ntuli has been saying, we've been part and parcel of it. And we embrace technology because we really want to see services are being provided in a quality way. And we are very much satisfied in terms of the pace of how the government has been digitalizing the healthcare service delivery. And the fact that we have seen, or we have heard from Dr. Issa, that they've been able to develop the national digital health strategy. I also know that from the mainland, we also do have the national health digital strategy. This shows that the government is really committed to moving or digitalizing the health service delivery in the health sector. So we are here to support, and we've been supporting a number of our services. Cannot mention one by one, but just to mention that in the HRIH system, we've been supporting the system that is helping to identify and allocate healthcare workers in the facilities. We've also been supporting the health financing system. We've also been supporting the M-Health in terms of M-Mama. We've been the first ones to work with the Vodacom to do this pilot in Shinyanga. And we've also been doing a lot of digital health solutions in the community sector, in the community setup. So we are really into helping the government reach their goal of digitalizing the health service delivery.
Asante sana, Dr. Emma. Essa, over to you. Since morning, okay, we've been hearing about systems, programs, development, and we've just heard from Dr. Ntuli, so much is happening. If you go on to the public sector side, there's so much innovation, eager, all that. My question to you as an introduction to you, maybe you want to tell me, in your personal opinion, do you think the innovators still have a role to play, or do we really rather need to engage the likes of USAID and Vodacom to focus and strengthen the existing platforms?
So that's a very tricky question, because what we've started to see, as the first speaker was saying, is also that because of all the innovations that have come into place, our digital health ecosystem has had a challenge. We now have too many systems. Recent mappings have shown that there are over 120 different, or 160 if I last remember correctly, different health systems that have been developed for our national healthcare and health delivery. And what we are seeing is that there isn't enough uptake on all of the systems. So yes, we need some forms of innovation to make these systems more relevant, more applicable, but also to balance it in a way that we're not creating more redundancy, because we've seen a lot of siloed systems that just don't interact and communicate with each other. And that forms a very nice segue into what I'm trying to do with my company. So we talk about legacy with emerging technology, but what does that really mean? It's basically, we have VIMS, we have TIMRI, we have DHIS2, we have all these systems, but part of that is there's a certain bulk that comes to creating, maintaining, and more importantly, using these systems. You train the people to how to utilize them, making sure it's used efficiently, the data centers they're stored on. Sometimes you'll open VIMS before it actually loads up. You're waiting there 3 to 5 minutes, just waiting for the dashboard to actually load. Are there platforms that these decision makers, healthcare managers, are more used to that they could utilize to get access to the same information and data-driven processes? And really there is. We use it every day. It's a green little app called WhatsApp. Everyone here who has a smartphone probably knows WhatsApp, has used WhatsApp, even at district levels. And interestingly enough, in some levels, for example, during the higher periods of the COVID pandemic, when the vaccine started rolling out, we found out that how was the reporting of the number of vaccines that were being done recorded? There was a giant WhatsApp group where everyone was sending in updates that today we've done these many people, today we've done these many. Can we link these systems that exist directly to the national systems which are used at higher levels to aggregate this? And once that linkage between legacy systems, which one we might define as legacy could be interesting at that point in time, but what are the more advanced analytics we can enable? Once we have the levels of deployment of IoT, we have that data flowing through. How do we start using predictive technologies? So a technology that was also built on top of TIMRI and VIMS was a system called PSCV, the Predictive Supply Chain for Vaccinations. And that used machine learning to identify regions that were going to be out of stock and predict how much stock should be allocated to those regions. And it was done at a very small pilot level, but it has been done in Tanzania using Tanzanian data and is looking at scaling up to the next level. So there is balance between, yes, we need innovators, but we still do need to work together with the development partners. And that's why my question on open source earlier was necessary, because it's hard to commercialize open source. It is a difficult challenge, yes. But when we talk about a public health system, we can't be locked in by a particular vendor. A vendor lock is a very dangerous thing, because yes, the vendor, the provider might be very well established, everything great, but you never know what can happen in the future. Having everything reliant on one source is a very dangerous thing. And with open source, you now open it up to a community of practitioners. It's not limited to just certain people. It's open to anyone who has the interest and passion to contribute. And more importantly than that, from the security point of view, the more eyes you have on an application, the more the system's developed, the more secure and integral it can be. So finding that sweet spot between, yes, we still need innovation, how do we bridge the systems that exist, how do we improve delivery? M-Mama is an amazing application. Can we make the delivery in such a way that we are just using SMS instead of a mobile application? Instead of calls, can we just do SMS-based delivery, WhatsApp-based? Does the driver really need to download an application or have an application loaded? Or can they just do everything through systems they already have access to? And UNICEF is a very good example. They've actually done this with a platform of theirs called U-Report, which they have deployed to over 250,000 youth in Tanzania itself. I'll stop my rant there.
Asante sana. Isa, niruhusu kama sio profesa basi nikutakia uprofesa for the sake of this plenary, naomba nikuite Professor Isa. Professor, asubuhi tulimsikia naibu waziri akisema kwamba vijana wana nafasi kubwa sana kwenye masuala ya innovation. Una deal na vijana. Vodacom they walk the talk. I like you to say that. They walk the talk. Umeona watu wengi sana kwenye Vodacom, lakini pia innovation zao nyingi sana zimelenga vijana. Wewe ukiwa kama mtu ambaye unahakikisha vijana ni sehemu ya kuelekea uchumi wa kidijitali Tanzania, kwa nini unahisi kuna umuhimu sana wa kuzingatia hii inaenda sana kwa vijana? Kwa sababu tuna vitu vingi vinavyojitokeza. Tuna AI, machine learning, deep learning, computer programming, etc. Kuna vitu vingi sana, lakini kwa nini vijana specifically, na tunawezaje kuhakikisha vijana hawa ambao tunawapa huu uwekezaji? Kwa Vodacom ni uwekezaji, kwako pia ni uwekezaji, kwa wote hapa ni uwekezaji, kwamba kesho utatatua changamoto ambazo tutakumbana nazo kesho kutwa, au leo solve the problems ambazo tutakutana nazo kesho. Kwako Professor.
Nashukuru sana. Mi kwanza naomba niongelee challenge ambazo tunakumbana nazo huko vioni na vijana wangu. Challenge ya kwanza, upande wa data. There is no any data available ambazo zinaweza kuwasaidia hawa vijana kufanya kazi zao. Wakihitaji data kwa ajili ya kudevelop hizo machine learning model or artificial intelligence model, they are not available. All the data or data repository are from US or other country, like UCI, University of California, Irvine, au Cargos. Kwa hizo data au model ambazo wataenda kuzidevelop haziwezi kusaidia kwenye environment ya Tanzania, especially in disease diagnosis. Mtu anachukua data kutoka UCI ambayo iko USA za breast cancer for example, anatengeneza model kwa ajili ya kudiagnose breast cancer, alafu anakuja kuimplement hapa Tanzania. Is not going to work. Kwa hiyo challenge ya kwanza ambayo ni ya muhimu na nahitaji serikali ifanyie kazi upande wa data sharing and data accessibility kwa wanafunzi wetu na pamoja na wananchi wetu. Mpaka sasa hivi wananchi labda au wanafunzi wetu wakihitaji data lazima waende hospitali, na hospitali wanasema kwamba tuwezi kuwapa hizo data, we cannot give you the data without the letter. Kuna bureaucracy nyingi sana hapo,
Hiyo nani ya kwanza, challenge ya kwanza. Challenge ya pili iko kwenye infrastructure. No any infrastructure available to do all this machine learning modeling or AI modeling. They are not there. Ndio maana sisi kama UDOM tumehangaika mpaka tukapata fund kwa ajili ya kuestablish AI lab at UDOM. Still, hiyo fund ambayo tumepata 1.8 billion is not enough to establish AI lab. Na still bado kuna bureaucracy nyingi. Mpaka saa hizi imagine tumeorder vifaa mpaka saa hizi havijafika. And we need to do a lot of work regarding the social problem, disease diagnosis na hivyo vitu vingine. Kwa hiyo infrastructure is not there. And as you know, the healthcare data, they are very sensitive. Hawezi kutumia cloud. Of course cloud it is available, but we cannot use Google Colab. No. Hiyo kitu haiwezekani. Hata hospitalini hawezi kukubali. Wakapa na hata hizo data lazima watauliza, je, hizo data mnaenda kuzitumia kwa ajili ya nini? Majina yanatakiwa yasionekane. IDs isionekane. Kwa tukiweka kule kwenye clouds, what will happen? Ndio maana sisi tukaanzisha ile lab pale ili hivi vitu vyote visende kwenye clouds. Swala jingine, AI policy, strategy and regulations are not there in Tanzania. Still we are struggling. Tunajaribu tufanya initiative kubwa mno. But paka sasa hivi there is no AI policy, no strategy, no regulations. Sasa hizo AI tools, how are we going to implement it? Wanafunzi wangu wengi tumefanya vitu vingi sana, a lot, big things. But we cannot use them. We cannot implement it. Well, there's a big problem in AI implementation in Tanzania. I think you can feel me. We need AI policy, we need AI strategy, we need the regulation to implement AI. Hata tukisipeka huko hospitalini hawezi kuzitumia.
Kwa maneno,
because there's no any policy.
Yes. Kwa maneno ambayo aliyatumia Rosaline awali, kwamba na Innovation Week Tanzania kwamba tuna platform hizi za kujadili kusudi tutoke hapa tulipo
kabisa,
kusudi labda USAID wanatingisha kichwa hapa wakusikie na wakuone. Kukusikia wamekusikia, labda wakuone. Lakini kwa kauli zako Profesa, labda utanijibu baadaye. Unahisi sasa tufanyeje? Tuache, tusiende huko, turudi nyuma, au unashauri tufanyeje? Lakini wakati unatafakari hilo utanijibu kwa sababu tunasema kwamba tuone obstacles kama stepping stones. Naomba nirudi kwako Dr. Ntuli. Umemsikia Profesa akisema tuna changamoto ya data, na nadhani akamalizia kwa kusema labda ni swala la access. Data tunazo, kwa sababu pia nadhani katibu mkuu amesisitiza kwamba unapobuni au unapokuwa na ubunifu wako lazima uwe una malengo, na malengo ili yawe malengo timilifu lazima yawe backed na research, lazima yawe backed na data. Kwako Dr. Ntuli.
Asante sana. First of all, I'd like to appreciate Professor kwa contribution yake kubwa, and to me I'm super happy kwamba we are sharing this panel together. Sisi for the past 2.5 years tulianza kufanya kazi na University of Dodoma. So last year we signed a memorandum of understanding. So nadhani as soon as we conclude our panel, I'll have to reach out to the professor and also have some discussions. We have abundance of data. Wow. Abundance of data. All what we need is just to follow certain procedures, kwa sababu swala la data security should be part of the equation. So tuna MOU with University of Dodoma, MOU with Mzumbe University. We are trying to conclude now MOU na Muhimbili University, na tumetumia my department kuweza kuestablish hizo MOUs. Now we have a PhD candidate from University of Dodoma, master's students. Kwa mfano I'm happy we have some students, undergrad na masters, huwa tunawaambia wapi the research area, what are the research questions ambazo when you go and conduct your research zitakuwa zina manufaa kwa nchi yako. So I think kwa kitu alichokisema professor, next year when we meet here itakuwa different story, kwa sababu we'll have to discuss and see the best way how wanafunzi wakaweza kutumia pale. Na sisi tunataka masuala artificial intelligence, kwa sababu we have learned from literature from other countries what artificial intelligence done to kwenye healthcare system. Kwa hiyo when it comes to the data, it's not a challenge. We have more than 4 million data elements. Kwa sababu kwenye artificial intelligence you need a lot of data for you to be able to come up with something. Kwa hiyo mimi nadhani what our professor said, sisi as a president's office will be more than happy to work with him to making sure that we address this challenge which has been presented. But lazima kuwepo na system sasa. Hatuwezi tu mtu akasema anakuja kuchukua data za Macall Health Center dispensaries without having any binding document. Lazima kuicho kitu kifanyike ili kuhakikisha tuna protect rights za mgonjwa na pia ku-enhance accountability. So I thought I needed to respond to that, but he brought in a very important issue and I'm happy he brought it today while I'm here. So tutafanya kazi naye vizuri tu.
Asante Dr. Ntuli. Prof, nadhani tunaelekea pazuri. Pongezi kwa Vodacom kwa kuwezesha platform hii, maswala yanajibiwa hapa hapa. Dr. Jema, nikuulize swali moja. Naomba tuandae maswali, nauliza mimi matatu alafu nitaruhusu open floor. Tutauliza maswali yetu ili na ya kwenu pia yaweze kujibiwa. Investments nyingi sana zinafanyika Tanzania. Sitataja kwenye kilimo, sitataja kwenye elimu kwa sababu sasa hivi tunaongelea kwenye sekta ya afya. So much is done in the health sector. So much is invested. So much is, this is also an investment in the health sector. USAID mna inject resources kwenye health sector. A lot of resources. Yani ukisikia matangazo redioni utasikia kwa udhamini wa watu wa Marekani. Dr. Jema ujue ameshaweka mkono wake pale. Naomba tumpigie makofi Dr. Jema. Very good. Dr. Jema, USAID kwa kuendelea kusupport innovation namna hiyo, kufanya kazi kwa karibu sana na Vodacom, mama hiyo piloting in Shinyanga, inaonyesha kuna levels of satisfaction ambazo USAID as an organization mnazo towards the growth, towards the transformation, towards the advancement, towards the digital technology. Tunaomba tueleze kwa kifupi ni vitu gani ambavyo they tickle you. Mama anasema unakuna na naye anakuna na puliza na kupapasa na kila kitu, ambavyo vinawafanya nyinyi kama USAID muendelee kusupport innovation and especially kwenye health sector. What are the indicators ambazo zinakuonyesha levels of satisfaction ambazo innovators ambao wako hapa pia labda wazijue, labda wazige, labda tuendelee?
Asante sana. Yeah, so I'll go direct to the response. Kwamba vitu ambavyo vinatuonyesha kwamba digitalization au innovations zinasaidia kwenye health sector is to see the improvement in the indicators of the health sector. Kama tulivyoona hapa mama wameweza ku reduce maternal mortality by 27%. 27% is a huge achievement, kwa sababu kama daktari alivyosema for the past nadhani 40 to 50 years tumekuwa tukistruggle kuongeza hata tu 10% improvement. Kwa hiyo kwa kuweza kuwa na innovation or solution kama hii within 2 years, yeah, within 3 years tumeweza ku improve by 27%. That's a big plus for us, na ni kitu ambacho kinatuonyesha kwamba really digitalization is helping to improve the health health services to the community. Lakini pia imetusaidia ku address a lot of health problems in the facility as well as in the community. I'll give an example. For instance, in the HIV sector, wakati ugonjwa wa HIV pamoja na ukimwi umeingia nchini, kulikuwa na tatizo kubwa sana la watumishi wa afya kujua jinsi ya kutibu, kwa sababu ulikuwa ni ugonjwa mpya na hasa kwenye kutibu watoto. Kwa hiyo tulianzisha hiyo digital solution ya kusaidia kutrain healthcare providers huko alipo. badala ya kuwatoa kule kwenye facility zao kuwaleta mahali pamoja waweze kuwa trained, tulianzisha system ambayo ilikuwa supported through Baylor program to train healthcare providers where they are, kutumia pia call center. Yeah, we use the call center. Baylor walikuwa na host your call center, kwa hiyo healthcare providers walikuwa wanaweza ku call in anytime kuweza kupata msaada wa kitabibu ili kuweza kuwasaidia wale wagonjwa wao. Lakini pia tulikuwa na issue kubwa kwa sababu ulikuwa ni ugonjwa ambao inabidi watumie dawa throughout their life. Kwa kulikuwa na wagonjwa ambao walikuwa wanapotea, hatujui wanaenda wapi na hatujui kama wanaendelea kutumia dawa vizuri. Kwa hiyo kwa kutumia pia digital solutions tuweza kuwasaidia kuweza kuwapa what we call the SMS reminders, ambapo walikuwa wanapewa alert kwamba dawa yako inakaribia kuisha, rudi hospitalini, na hiyo imetusaidia kuimprove retention by almost 30%. Kwa hiyo vitu kama hivyo vinatuonyesha kwamba digitalization ina improve the quality of healthcare services, na ndio kitu ambacho kinatuboost kwamba tuweze kuendelea kusupport.
Asante, umenijibu vizuri sana na kwa mifano hai kabisa. Pongezi, na naamini baadaye utasema au utaita more stakeholders could support the healthcare ili tuwe tuna provision nzuri. Esa, I look at you as a tech guy because you are. And as a tech guy, kama tulivyo na Ntuli na Jema lakini pia na Professor, I want to confirm that you have a third eye in observing, in following up global trends, where technology is taking us across the globe. What are some of the things that Tanzania now can learn from the best practices globally so that, you know, we can speed up the digital transformation, especially in the provision of health services across Tanzania? Karibu sana. I like the smile. It's the first answer.
That's because it ties into a lot of what I want to say right now. Some of these comments have really lit a fire under me where I might say some things where in advance I don't mean it as something harsh, but it's my passion that comes through. But first I must commend that we are not entirely lost or not making any progress in terms of, let's say, AI regulation and such. So both of us have been part of a process in which the Ministry of Health and PATH have been doing great work to support the education and awareness increase on artificial intelligence usage in the health sector. And the University of Dodoma has built courses to support healthcare workers on that. But more interestingly, there is the development of an AI policy framework. So not yet a policy or a framework for an AI policy, which is being created, led by the Ministry of Health and PATH. So that is happening, and it's just very interesting to see that the development and lead of an AI policy is coming from the health sector, which in of itself is probably the best. We should look at technology as a tool for application, and it's applied in other sectors. So we need to work with those sectors to make sure the application is positive. Secondly, the University of Dodoma is doing great work, and their student body is very active. So I run the Tanzania Ai Lab and community, which is an artificial intelligence community for the country. We work to advocate and capacity build students and youth on the technology. And a good portion of them are from the University of Dodoma. So that's great. But now this is where the passion comes in. But from most of this conference in of itself, we see that a lot of the innovation, no offense, is not driven by universities. Most of the innovation is driven by startups, innovators. Yes, they may have come through a university, but most of them are gonna go out and start their own small companies, their own startups that are gonna go lead interesting things. A lot of them are local, and we see a lot of startups coming out of University of Dodoma as well as the other institutions with AI, Tanzania Data Lab and UDSM, Nelson Mandela, amongst others which I may be forgetting right now. But we are seeing a lot of these solutions coming out from startups. They're the ones who are driving a lot of the quick, agile use case of these technologies, of the digitalization. Therefore, I challenge the perception or the direction that the data accessibility, because we have the data, it's recorded, we have the systems, DHIS2, VIMS, TIMRI, Sure, they might not be as detailed as we might need yet, but it's a good starting point. Why should this access to the data only be to the universities? We need mechanisms for innovators and startups to have access. Yes, we understand the limitation is around the privacy of the data. That's a big issue. But do we know we have statistical and mathematical methods to anonymize data in such a way that it can never be traced back to the individual patient? We have methods such as that allow us to anonymize and open up the data to certain levels. And the process to access that data, if it requires being attached to a specific research-based institution, then how do startups move? The process of getting an MOU with a university is a process, let alone talking about an MOU with the government side of things. Those who've done both know the process. It's a process. So if we can have systems that enable a smoother pipeline, what is the data you need? What is the application? What is the range of that data? Do you need personal information? No. So this is the level of access that you're able to obtain, and this is what you need to do to be able to access that. We're making great progress with the one-stop shop that's being set up at all the new post offices. Do we have something like this we can start to do for data and innovation use cases? So when it comes to the lessons that are learned from external to apply internally, globally we are seeing the development being driven by agile young individuals or organizations. They could be startups, they could be companies, but the agility and the speed of development and deployment is very essential. And also leveraging existing tools that are already there. We have the foundations, we have certain elements in place. How do we bring all of these together and enable that scale? We talked about just, the number was, Jimmy, correct me if I'm wrong, 180 healthcare-based startups. If we did a proper mapping of Tanzania, we would find even more than that just in our country. I personally know at least 5 to 6 AI health startups in Tanzania, just specifically to AI-based health startups. But a lot of them are facing similar challenges. One has a post outside as well, Saratan AI. They're building a cancer detection system. But the data they've had to use, they haven't been able to use local-based data. Even though to some extent they have partnerships with the Muhimbili University. There are still limitations there because yes, health data is very private, understandably so. But are there ways that we can anonymize it and make it safer to share and innovate upon?
Asante sana. I think I was asked a question recently. Do we need to actually bring people from outside to resolve our challenges internally? Dr. Ntuli, you respond to that. Oh, you have already responded to that. Data is an issue. Data is a challenge, but Dr. Ntuli says there is plenty of data. Let's establish the mechanism so that this data is made available so that we can actually be able to do discoveries and innovation. Professor, it's probably a joke or probably happened. A man was walking alongside the graveyard and he said, you know, many people have died and are buried here, and this is probably the richest place on earth because people with brains are buried here. People die with ideas. You've recently said that, you know, you have students who have had great innovations, but these innovations are on the shelves. Yeah? Vodacom is here, USAID is here, development partners are here, Innovation Week is here, the world is looking at you now. How do we then move this innovation from the shelves? They're already there, they have been created, you've called them outstanding, you've called them remarkable innovations. How do we bring them to the surface? How do we bring them out in your very humble submission? How do we bring them out so that they address the challenges, cancer, malaria, you name it, especially in the provision of health sector? How do we bring them out? You've mentioned the 3 challenges. Data is an issue. Ntuli has responded to that. We'll accord you with the data. You've mentioned 2 other challenges, but how do we bring them out?
Yeah, I think like 2 weeks ago nilikuwa Arusha na tuna train watu wa Wizara ya Afya, nikaeleza hizo issue, hizo challenge ambazo tunazo. Wakasema wao hawajui chochote kuhusu hizo tools au hizo application. Kwa walichotushauri tuende pale wizarani tukapresent hizo ideas, kama ziko vizuri then they can take it from there. Hiyo ni kitu cha kwanza walichoshauri watu Wizara ya Afya. Anasema nyewe mko UDOM hapo, lakini nasikia mambo mengi sana mnafanya, lakini sisi tuko hapa karibu, hatujui chochote kile kinachoendelea. Kwa hiyo nafikiri kitu kikubwa au challenge kubwa ambayo ipo, we don't know the right people to go and see them. Challenge iko hapo. Kwa hata wanafunzi wetu labda nataka kwenda kufanya kitu fulani au collect data set fulani, they don't know the right person or the right people to go and see them. Kwa hiyo ndio challenge, hata sijui tutaiwekaje. Na nachoshauri mimi au nachoshauri serikali, najua watu wa serikali wapo hapa, kama tutaweza kuanzisha AI workforce. AI workforce wakaunda timu kwa ajili ya kuchukua hizo challenge zote na kuweza kuzifanyia kazi, upande wa policy labda strategy, yani challenge zote ambazo zinahusikana na AI waweze kuzifanyia kazi. Asante.
Asante. Interest of time, my last question will be their last remark. May I take the questions from the audience now? Naomba nichukue maswali kutoka kwenu kuja kwa wataalamu wetu. Kwa kifupi kabisa, utasema jina lako na uliza swali lako moja kwa moja. Tuna dakika 5 za maswali na majibu, then tamkaribisha Ajun na tufungie, alafu tutakuwa tumemaliza session yetu kwa mchana huu wa leo. Kama mna maswali, mimi nikaendelea na maswali yangu. Good. Upande huu. Can we do the swap? Wa huku waje huku, labda upande unachangia au jua linakuja huku sana, nimewasamehe.
My name is Masudi Mnonch. I work with Ifakara Health Institute, but also we have the innovation space now in Ifakara. This is more of a contribution to Professor Salim. Last year, in December, we had a medical symposium. A symposium for medical innovation and the healthcare system. And Dr. Mtuli was one of our guest speakers. And out of that innovation symposium, we had a discussion with the regulators, policymakers, including TMDA and COSTECH. So at the end of that discussion, we faced one of the biggest challenges, as you mentioned, which is the regulatory framework. It's not there, especially on medical devices and healthcare systems. And then moving forward, we took that challenge to further. And then now I'm trying to give the information that we're working as Ifakara Health Institute, we're working with TMDA and COSTECH so that we can be able to get at least a framework for the medical innovation. I hope the AI could be one of the area or agenda within the framework. And by the end of this June, probably, we might have the first discussion on how we can get all different partners, key players on the medical industry, and then maybe we could come up with a guideline. Thank you.
Yeah, my name is Baraka Range from University of Dodoma. Sorry, I may be mixing Swahili and English at the same time. Yeah, Soma and Swahili, it's like contributions. The first session was about something about health, and now we're talking about artificial intelligence. Now, the contribution goes to Madam Julia plus suggestion to Mr. Tulia, because Mr. Tulia said that he also participated in Shinyanga and Mama, right? Yeah. And also, I remember there are some questions behind that. How does a mama? There was some problem behind the mamas. People were asking the questions, but through the data that were collected, because I know for the mama was a system, and the system actually collects some data. Now, from the data that we had from the Shinyanga, I think by the combination of D-Labs, therefore, and also UDOM, we can do some artificial intelligence combination of each that can lead for the predictions of some, maybe we had the problem of about, we say that there are some damages, about car damages, right? Or maybe a lating. But we know that for someone to be in a mama must register before the day of emergence, right? But now the time on registering the day of emergence means some datas that they are already in a mama systems that there is a woman around Shinyanga at a certain place is maybe having a 4-month, and maybe a woman around maybe Shinyanga somewhere having a 9-month. Now you can predict those who are having maybe a 6-month, a place having a 6-month, we can able to keep some drivers and some emergency nurses by the time being. That by that time being there are being already some drivers, already some nurses. Now when shifting to another place, it will be very easy for them now about the issue of emergency issues to about lowering about something about emergency issues. Thank you.
Asante sana. I will take 2 more questions, if any. Yeah, one this side. Hey.
Thank you. Okay, I'm Sengayo Gideon. Sorry, I'm Sengayo Gideon from the University of Dodoma. I'm taking software engineering degree. Technically, my contributions not so much as questions as suggestions. Tukianza from alivyoanza Katibu wa Wizara, something like that. Katibu wa Wizara spoke about the 4th Industrial Revolution. Sasa I'm also a person ambaye nadili sana na this revolution. So I'm so deep into it, I'm passionate, and my contribution is that what does Vodacom or USA and the rest who are here, I'm seeing a lot of logos on the other side of the tracks. So what do they do? Because we know the 4th Industrial Revolution is age of intelligence. That's when we talk about that, we combine IoT, big data, AI. We are just on the same track. So I believe the starting point from innovation or changes is from students, universities at large. So what do they do? Because university students need eyes and hands from maybe stakeholders or other entities outside who can accelerate the ideas from the students. So what do you do? Or should I say, I suggest that there should be a very friendly program which can reach directly to the students. Students' innovation and ideas. Trust me, when you come to the University of Dodoma, just take a 1 week rotation there, asking people, okay, what do you do in AI? What do you think we can do? You will come up with not less than 50. Trust me, 50 ideas where you can build something. So I will give a very slight example. We have, if anyone knows about the Huawei ICT competition, it's a competition that reaches directly to the undergraduate students, where people can, students actually, not people, students can show their talents. So I would like, or kindly request, a creation of a very friendly program that goes directly to the students from the universities to see what they have. Because right now, currently, the way I see things go right now is that you have already done something. Through your challenges, you've already done something, then we come and see, okay, this is what you've done, this is the potential, so, okay, let's take you there. But not everyone, by their own, can reach that stage where you can see the person. So, just that, friendly program, just that. Thank you.
Asante, very great contribution. We have the final one. And then I will ask my one question. These are all contributions, so they're not direct questions.
Try to escape from university and start new startups. But when you come to startups, for example, sometimes it's very difficult to raise funds. For example, another study showed that more than 50% of all startups that have succeeded to raise funds, in most of them, people are those from people who have studied abroad, who have experience of working with people from outside the country. But when you come to people who we studied in, we are born in Tanzania, we study in Tanzania, when you come to the factor of raising fund, it become very difficult. And other challenge, for example, when we are talking about data, for example, as Professor Salim said that when you train your model by using outside data, for example, from US cargo or what, your model not working until when you train it by using your local data. For example, we have still struggling with data, for example. We have set a lot of meetings with specialists or leaders from Muhimbili National Hospital, from MNH, until when the time comes where we have an access to those data, the university is not able to support us, because most of those data, for example, are in slides, that we can't use them in slide until when we digitize them. So when you come to digitize those data, we need a lot of data. And for example, at MNH, there is a lot of slides. They've been stored for more than 20 years. There is a lot of slides. But when you come to convert those slides into a digital image, it becomes another problem, because you need to have a lot of money in order to convert, to have those data sets. But when you come to how are you going to obtain that money, that becomes a very big challenges. So you are still struggling and moving around the same point. So what I was suggesting that maybe you can find a way that how are you going to support these startups, for example? How can they have an access to those data? Can they move, for example? Thank you so much.
Asante sana. That marks the end of the contributions, questions, remarks from the audience. I'm going to give you each 1 minute, and please make it 1 minute. Based on what you do, based on where you are, why is it important to innovate healthcare provision? Your concluding remarks, and that will be...
Thank you very much indeed. And first of all, I'd like to commend all the students who ask questions. Those are very pertinent questions. We as a government, we embrace innovation, and I would like to affirm the commitment to supporting innovation space. Na kwa kuangalia Professor Chosema, with regard to data availability, I'll make myself available anytime, tampa contact ili tuweze kufanya kazi kwa pamoja. Lakini with regard to what my colleague has asked, ni kwamba we have more than 200 MOUs at President's Office, not only with universities, with the PATH, with USAID. If you have your organization, we'll be more than happy to work with you. Na sisi work on every Monday and Thursday. We invite different organizations to come up with their presentation, to present to us, ili tuweze kufanya nao kazi. Lakini why did we decide to have MOUs with university? We clearly saw the gap between we from the industry side na academia. Kwamba you go, people are getting PhDs, are becoming professors, but what they have actually published or walichokifanyia research, they never been actually used by us. Kwa ndio maana sisi we thought we needed to bridge that gap between the industry na upande wa shule. Sasa with regard to the stock visibility solution, sisi tutafurahi sana, and I have a colleague from Zanzibar ambaye ameattest the beauty of that system. So tutafurahi to work with Jimmy and others to make sure that we also replicate the Zanzibar experience to the Tanzania mainland. Kwa hiyo sisi tutafurahi sana kufanya kazi hivi. Otherwise, I should take this opportunity to thank very much Vodacom for this very important occasion, and look forward to working with you. Asante.
Nashukuru sana. Doctor, over to you. Dakika moja.
Asante sana. Yes, and for me really I want to commend all the questions. They're very good questions, and maybe just to add a little bit on the last question about how can they mobilize funds, or how can they raise funds for their innovations. As Dr. Ntule said, they do have meetings. We also have, as DPG Health, we do have meetings every month. So you can also come to DPG to present your ideas. But again, I just want to plead to innovators that we really ask you to provide solutions that are sectoral, that use the sector approach. We really need to have client-centered solutions. We have a lot of silo silo systems that are not even interoperable, and therefore it becomes very difficult for us to continue funding them because we see that they're not sustainable. So if you really want to be funded and maybe secure your resources, I really urge you that you find solutions that are client-centered, but also you work with the government to address the real challenges in the system. Yeah, I think that's it for me.
Asante sana. Ese, over to you.
I'll try and keep this short. First, again, it's amazing that the ministry and the president's office have these agreements and all, but I'm still going to emphasize on the need to work with startups and younger companies and innovators rather than nonprofits. A simple example, us at the AI Lab and community, we worked with a company called Sahara Ventures, and within 6 months, we did a program where we identified challenges within the health sector. We documented the challenges on how they might be approached with an AI point of view. We built solutions of those problem areas with innovators, with healthcare workers, and we open sourced all of it within a period of 6 months, in which many university students took part, in which youth who are not in universities took part, in which healthcare workers from different institutions and different facilities took part. And that is the program through which Tanzania AI was actually born. And that was done with a program that collaborated with universities. Yes, we worked with D-Lab a little bit on that, but primarily it was based around the innovators themselves. Not even the university institutions. Universities are great at their research work, and there is that gap that, yes, we need to fill that gap between research and practical application, but also for sustainability of research, we do need to look at commercialization. And commercialization of students' projects are done through companies or social enterprises, but in Tanzania there's no such thing as a social enterprise, so it's a company. So with that, it's great, and that partnership will need to grow. We don't know what it looks like. We don't know what the mechanisms to access the data for young companies look like, but we want to work together to build that. To work with groups like the Tanzania Startup Association, the AI Lab, startups such as Afya Intelligence, Tanzania AI, development partners. What mechanisms can we build? And in reference to USAID's work and support and the development partners, it's amazing, but a lot of young companies and students and startups didn't know about global goods being so important, about the importance of open source and interoperability. A lot of them build systems by identifying a challenge in a space, and they go build. That's typically how they go about it. Then later on they're told, we can't integrate your system with the government because it needs to be open source. And the student is then going to ask, but if it's open source, how do I make money and sustain myself and the company? And we end up in that problem. So we do need a lot more awareness around that space. But innovation in the healthcare is still the most fundamental area. Healthcare affects everyone, and it holds the most opportunity and value because we've established the partnerships are there, the development partners are there, the data is there. They're just kind of siloed like the health systems themselves. We really need that interoperability between them, whether it's artificial intelligence or IoT or more basic solutions. The data becomes the foundation. The partners work together to build the innovations on top of it. And the talent we have in the country is more than enough to build some very amazing things. Thank you.
Asante sana. Esa, a big round of applause to Esa. And finally, Professor kwako sasa, neno dakika moja.
Mimi nawashukuru sana Vodacom, Wizara, USAID. Ninachoomba kwenu nyie tuendelee kushirikiana kama mnavyojua pale UDOM tuna hiyo tuna establish hiyo AI4D lab and for Anglophone Africa, not for Tanzania. Kwa naomba mtusaidie ili lab ile liweze kusimama, ili wa Tanzania waweze kuja kufanya pale research zao na hizo solve hizo problem nyingine ili mambo yaweze kwenda vizuri. Kwa hiyo naomba sana watu wa wizara, naomba sana Vodacom, naomba sana USAID, pamoja USAID pia ndio pati ya hiyo ambao mmetupa. Naomba mje pale mtusaidie, au pia mnaweza mkatupa idea nini tufanye na mambo mengine. Asanteni.
Asante sana, naomba tuwapigie makofi mengi kabisa panelists wangu. Naomba mje hapa tupige picha ya pamoja, naomba tusimame hapa mbele. Camera, wakati basi tunapiga picha pamoja, atakuja dada Harriet kutoka Vodacom, Head Director of Customer Service, ataongea na sisi, alafu atamkaribisha June kuweza kutufungia. Asanteni sana jamani, well done jamani, nashukuru sana daktari, asante, nashukuru sana. Naomba tumpigie makofi mkurugenzi wa Customer Service wa Vodacom. Akimaliza yeye kusema machache, atamkaribisha Arjun aweze kutufungia session yetu. Chai, tutakunywa chai, na mimi kila mtu amepata kuponi yake. Baada ya hapa ni chai, na nimeombwa niwaombe wote tuwepo kwenye chai kwa ajili ya networking. Asante. Harriet.
Asante sana mchokoza mada. I learned something new today. So, Kwanza, I'd like to say thank you very much to the panelists. Very insightful and engaging discussions. And more importantly, asante sana to the participants who asked questions, who listened, and who came through. Tunashukuru sana. As was said earlier on, bila audience, this is just an empty room, na tunaongea na wenyewe. Most importantly, and why I'm up here, is I'd really like to thank the university students. Primarily, I'm assuming is University of Dodoma. Shukrani sana kwa kuattend. And just by a show of hands, naomba kuona wanafunzi wa University of Dodoma. Nyosha tu mikono. Nyosha. Asante. So what I see here is a sea full of gentlemen. A sea full of gentlemen. Okay, I've been told Dodoma, CBE, and Muhimbili, Muhas are here. Nomba mnyoshe mikono. Definitely. Thank you. So I see a sea of men. My statement still rings true. A sea of men, and I think I've spotted 2 women. When my definition widened, it started with 1 from University of Dodoma, and it became 2 with the wider group. So Kwanza, pongezi sana for taking the interest in innovation, and huge kudos if you're venturing into the AI space. There's a lot out there, and I encourage you all to take it. Now, the reason why I've asked you to raise your hands is just to show that there is a huge disparity between men and women who engage in a lot of the technology subjects, or in this case, I'll reference STEM subjects, which are science, technology, engineering, and mathematics. So you always see the boys, the men, are the ones who are vying for these roles and these careers, essentially. But as Vodacom, we're trying to close that gap, and we actually have a program called Code Like a Girl. And what we're doing here is we're taking young women, teens, with the ages between 13 and 17, to inspire them to get into development, programming, understanding technology, and seeing how they can actually apply it. And in so doing, the idea is for us to build a pipeline to developers, innovators, technology thinkers who can definitely build a lot out there that Tanzania has to offer, the challenges that Tanzania has, and we can close them through this program. So I encourage you all to encourage your friends, your family members who are females, young females, to join these programs. I'm proud to say as Vodacom, we have been able to reach 1,000 girls in this sector, and that's just the beginning. There's a lot more to go. We partner with an innovation hub, Data Lab, who assist us with this program, and we believe there are a whole load of opportunities. So karibuni sana, watafute wasichana, vijana, waje, but not to say kwamba wanaume msiendele. Please do, please do, please do. You are definitely the developers, innovators of the future, and Innovation Week is here for you. Use everyone you see. Let's network, and let's keep growing this space. Asanteni sana. I would then like to invite Arjun, who is our director for Vodacom Business, for a note of thanks and closing remarks. Karibu sana.
Greetings, ladies and gentlemen. This was an incredibly illuminating and engaging discussion. I hope you can hear me at the back. I only have like 6 pages of notes, so I won't take more than 30-40 minutes to finish. So we're extremely grateful to be present here, as the panelists have shared a lot of valuable insights with us. We hope all of you sitting here got some value or insights out of this. My key takeout from the panel discussion is that there is abundant reason for us to use digital technology in healthcare. Small-scale adoption of this technology in pilot projects like in Zanzibar, M-Mama, have been largely successful, and scaling up is the need of the hour at the moment. As some of the panelists before me, I think Jimmy said before me, that the time is right. Africa may have missed the first 3 industrial revolutions, but the fourth industrial revolution is here to stay, and we at Vodacom believe that this is the time for us to start digitizing and speed up our digitization process. Many systems are available out there in the market. I think some of the panelists spoke about that as well, and there is a lack of integration between the system. There is a lot of data out there, but not available in a usable form maybe, or the policies, etc., are a little difficult for people to get access to the data. So as Vodacom, we always say, pamoja tunaweza, together we can. We believe that a digital connectivity can pave the way for successful social transformation in many aspects. COVID-19 has sharply illuminated the various shortcomings on the healthcare delivery across the continent and also across the world, but has also shown a hopeful light on many solutions that sprang up, exposing the need for change and innovation that technology can bring up. In many ways, the pandemic has opened our eyes to the need to digitize and accelerate digitization in the healthcare space. Every forward-thinking government today is looking at creating digital strategies for the healthcare sector. I think Tanzania is way ahead of the curve on that. The government is thinking on many ways and many aspects of digitization. As some people mentioned, I think there were many numbers, 180 startups, healthcare startups across Africa, and I think Salim says there are more than that, so maybe there are more. So with so many startups there is no better time to do it today. Alongside this, I think there are many challenges that were identified. I think the main challenge seems to be around data protection. There seems to be challenge around the processes and the policies that are adopted in sharing this data. I think trust is also a key issue, especially from a consumer or a patient standpoint, where patients aren't very used to digital interactions, especially for medical purposes. The use of informal digital methods like WhatsApp, etc., is also a double-edged sword. It works at times, but at times you really don't know. It's not a validated procedure at the other side, so you don't know who's on the other end of it as well. As well, digital healthcare delivery services that can widen health equality, because patients are at varied levels of digital literacy. So I think that's another challenge which we spoke about in the earlier session, smartphones. But these challenges also present a lot of opportunities, and I'd like to again express our gratitude to the panelists, to Professor Shemdoe, who spent a lot of time with us today, to the other sponsors, to the people coming from USAID, the UN, and the team at Vodacom. Our door is wide open. Please do come across in case we can help in any part of your journey in digitizing. Like I said at the start, we at Vodacom say pamoja tunaweza, so University of Dodoma students, karibu, we at Vodacom, our door is open. Please do come and work with us. We will reach out to Professor Isa to see how we can partner with you along this. Yeah, and thank you. And with that, I'll bring this session to a close. We've already run over time. Thank you.
Asante sana, tumemaliza, lakini tunarudi studio kwa tangazo kutoka kwa wadhamini. Vodacom Digital Acceleration Season 2 imefunguliwa mpaka June 30. Vodacom Digital Acceleration imefunguliwa, Season 2 is open till 30th of June, na wanapokea mawazo, lakini sio mawazo ambayo umeshayafanyia kazi, minimum viable product kwenye sekta ya afya, kilimo, fintech, elimu, entertainment, FMCG pamoja na cyber security. Ili kuweza kushiriki kwenye kinyang'anyiro hicho, tovuti ya kushiriki ni www.vda Vodacom Digital Accelerator, kwa kifupi vda.co.tz. Idea isiwe idea jamani, iwe kitu ambacho tayari umeanza kukifanyia kazi, unahitaji kiwe scaled up. Kwa hayo machache, nazidi kuwapongeza Vodacom kwa kazi nzuri ya innovate Tanzania, kuipeleka Tanzania in the digital economy. Makofi mengi kwa Vodacom. Naomba pia makofi mengi kwetu sisi wote ambao tumehudhuria. Asanteni sana. This marks the end. Naomba tuende upande wa pili wa booth yetu kwa ajili ya chai, networking and exchanging contacts. Karibuni sana na asanteni sana. Kudos. Well done.